My cable. Sorry. Didn't bring it back because I didn't.
Morning. The meeting is now called to order at 9 o'clock. We will now begin with a moment of silence, silent reflection, or silent prayer. Supervisor Elliott, will you please lead us in the pledge?
Please rise. I pledge allegiance to the flag of the United States of America, republic for which it stands.
Thank you. For the record, this is the March 31st, 2020 special meeting of the San Joaquin County Board of Supervisors. Will the clerk please call the roll?
Supervisor Villapadua?
Present.
Supervisor Patty? Yes. Supervisor Nguyen?
Here.
Supervisor Elliott?
Here.
And Chair Miller.
Here. Thank you. Now's the time for public comment. I want to first announce that to the public, this meeting is being live streamed at San Joaquin countyca.iqm2.com/citizens. You can also catch it on YouTube. Public comments have been limited to 250 words or less via email to cobrecords@sjgov.org. We will accept public comments during the meeting, and we will make every attempt to answer those questions during the meeting, but all comments received prior to adjourning will be read into the record. The comments made on YouTube are not considered part of the official record. They won't necessarily be shared with the board, so we really encourage members of the public to email the clerk of the board. Have we received any public comments yet?
Yes, Chair Miller, we've received quite a few.
Okay, great. Then let's go ahead and we'll take those public comments, and we will either answer them immediately, or if they pertain to a topic that's going to be discussed later, we'll hold them until later.
Okay. And I do want to summarize, we received 86 comments related to the golf course.
Okay.
So I'll just note that 86 comments were in favor of reconsidering opening the golf courses with restrictions on use of carts and the spread of COVID-19. And there was one comment in favor of keeping it closed. So I'm not going to read all of those comments.
Okay, and I believe we'll be talking about that as we get our updates on our discussion items.
Okay. I'll try to speak louder. Can you hear? Is that good? Okay. Okay, so we have received about 20 other comments that I'll read for the record. The first one is more than 250 words, so I'll summarize a little bit and read the parts that are important here. This is from regarding various county employees to make some of the BOS aware of the differences throughout the county related to essential and non-essential county employees. She's watched he or she has watched the last couple of BOS meetings regarding employees and understands that directions have been given to department heads to make decisions for essential versus non-essential employees. Admin has done what they're supposed to do, as has Department of Child Support Services. HSA has not. At HSA, social workers have been given remote access and modified schedules, and similar opportunities have been given to eligibility workers. Clerical support staff have been told that paper-intensive units would not be able to work remotely because they don't want paperwork leaving the building, even though this identical paperwork is given out of the building daily by SWs. There has been no distinction between essential and non-essential employees, even though the units that are directly affected by workflow and CPS have slowed down significantly due to schools being out. A select few have been approved for modified schedules because they can show that they can function within their positions digitally, myself included. But that means the other 10 in my unit that have small children or live with elderly parents are still being exposed to hundreds of employees just because they are paper intensive. We've been told that we don't qualify to sign additional confidentiality agreements to take paperwork home, which also tells me that clerical staff is being deemed unworthy of this while also being labeled essential. It can't be both ways. Our building still sees the public, and our building has circulated air. It doesn't matter if we see clients or not. We literally breathe the same air. There's been no restrictions on numbers allowed in elevators at a time or any precautions at building entrances. This county needs to do better. Sincerely and with concern, Jennifer A. The next comment is from Shelley Cunningham. It says, good morning. In light of the COVID-19 spreading and distancing order, I would like to know if we could be considered able to close our office to the public and put a lockbox outside for patients to do a drop-off of documents they feel necessary, to provide a phone number to please call for any questions. And this is from the San Joaquin General Hospital business office is where she suggests that. Next comment is from Kimberly Wormsley. She's a clinical therapist in San Joaquin County, and her question to the board is, how is the county addressing and or handling the residual effects of the environmental trauma, anxiety, and emotional distress this worldwide epidemic has triggered? I am deeply concerned with the frontline staffers, nurses, ER personnel, social service providers, etc. Are protective wear and screenings conducted to those who are working in emergency services that may be more readily exposed. Bill Patron writes regarding general discussion number 3, SCIU Local 1021 applauds the Board of Supervisors for taking this much needed and much awaited step to meet the needs of your employees, most if not all, who have been deemed essential by the county. It is our hope that the board will take steps to make this action retroactive to cover those employees who have been forced to use their own personal bank of time for their specific needs. The next comment is from Catherine Phillips. My name is Catherine Phillips, and I'm the director of Sierra Club, California. Our organization has several hundred members residing in San Joaquin County. Many of them are at particular risk of mortality if affected with COVID-19 because they are older or have underlying conditions. Public health officials and epidemiologists now say that wide-scale testing can help identify patterns of infection and help in decisions that can protect the public. Why has San Joaquin County not made drive-up testing available to members of the public? When will such testing be made available in San Joaquin County? Thank you in advance for your response. Linda expresses a complaint. She says, my complaint is why all the staff don't deserve protection. I'm nursing assistant. We are more in contact with the patients, not just the nurses. One nurse in ICU and 3B said you cannot use masks, just nurses. I think all the staff, we deserve to use masks. More if I bring my own. What kind the coworkers is that? We are human. We are same workers, same place. We are San Joaquin General. And this nurses think we don't deserve care, my own health. We don't have enough training in my department. I saw the nurses stress because they don't know how care in this moment. They transfer positive COVID-19 patients without protection. The housekeeper go behind cleaning with spray. What kind of the response is that? San Joaquin don't have any money for supply and do a good transfer to patients. All the staff is exposed. Please check all the departments. Information. Everyone deserves same protection, good training, enough supply. We have families to care too. I do my best for care all the patients and coworkers. I help to clean rooms, machines of vital signs, doors, handles, and of course clean my hands anytime. I will appreciate your attention. Mariah Looney writes, to whom it may concern, as a concerned resident of Lodi, I have a few questions for the board. How many ventilators are in the county at all hospitals? Are there plans to secure more? Number 2, how many total masks are in the county? Are there plans to get masks and PPE to hospital workers and first responders? And lastly, number 3, are insurance systems like Sutter and Kaiser being asked to tap some of their reserves to ensure their nurses have enough PPE to allow county resources that exist to be used by public health? Next comment is from Nathan Worth. He writes, there are common questions we're repeatedly seeing about COVID-19 pandemic and the state of our county that I do not see addressed on the county website. The current dashboard has updates on numbers of cases and deaths, and it also links relevant press releases. But providing answers and updates on the questions we repeatedly hear would be useful to us. And those questions, he writes, are, how are we doing on resources like masks, vents, etc., and what are hospital administrators anticipating our needs will be? Are we on track or will we be running short? What are current hospital staffing and capacity? This will help people determine where to go. Clarification on current policies of medical centers regarding who is being tested. Will you test me? What are they doing with symptomatic people? What do the current triage levels look like at each hospital? Can they even help me or see me, or will I just be clogging up the system by going there? By putting this specific information online, we'll provide people with a realistic picture of what they can expect from local services, which will expedite visits and help reduce hospital intake. Your communications plan is your most valuable resource right now, and it should have your greatest attention because the time you invest there vastly determines the impact felt by the rest of the system. Thanks. Nathan Worth. The next comment is an anonymous comment, and it states, I'd like for the board to outline how they are complying with CDC and the Human Services Agency. There are no masks, hand sanitizer, or disinfectant wipes provided to most of the building. Disinfectant wipes were actually taken from units. How are they protecting the employees and their families? There has been no limit in place on how many people are on each floor. There is computer equipment shared with about 16 people with no way to disinfect shared keyboards. Every time an employee walks in the building, they are putting their families at risk. Why has there been no option for people to work from home every day, especially if proof can be provided to show that they live with a high-risk person or are high risk themselves? The next comment is from Lisa Hamp, and it states, I have been an employee for San Joaquin General Hospital for 22 years. As you know, COVID-19 virus has literally been a nightmare for the staff at San Joaquin General Hospital and many clinics that are part of the San Joaquin General Hospital family. We are the front lines taking care of patients that might be positive for COVID-19. Then we go home and risk spreading the virus to our loved ones. Our clients and offices have no masks, cleaning wipes, disinfecting spray, and no clear direction. Our clinics aren't equipped for 6 feet apart spacing. Then employees have to take time off for illness, childcare, and doctor appointments. This puts most areas short of staff. Then on top of it, you've closed Manteca clinics and public health. Those areas need services due to lack of transportation. These areas are now prone to spread this virus. We still have much more cases that haven't been diagnosed. Please give us some help and leadership. And Richard Pajero writes, let's get positive. Let's get families in groups of 4 to clean not only the family yard, but the city streets. But we can't. Why? Because you've closed the dumps. What a lesson for these kids. Let's look back in 4 weeks and see a positive. This is an opportunity for our community to come together, not to waste this time. Please consider this opportunity. Barbara Barrigan-Perea writes, please ask public health officials the following questions centered around coordination between county public health services and other county hospitals. Number 1, when patients present with mild to moderate COVID symptoms, whether to county health or private hospitals, are they told to quarantine at home? Are their family members being told to quarantine as well? Are public health services and private hospitals being consistent in delivery of this message? Second, what is the coordinated plan between hospitals to make sure that those who need emergency treatment services receive it if there's overcrowding at specific hospitals? And number 3, what is the plan to expand hospital bed capacity, not just at San Joaquin County Hospital, but across the county to cope with the expanding need of services in the weeks to come and to keep non-COVID patients separate from COVID patients? Thank you for these answers. Tim Lowe writes, in this time of indecision that the board has failed to act on such a desperate time shows just how disconnected this board is in protecting its employees. The surrounding counties took direct action and sent all inessential employees home with pay. They didn't try to make the employees use sick time to pay for the order to stay home that they have saved. This board listens to miscellaneous instead of taking care of its employees. Put all non-essential employees on admin leave until this is over. Do the right thing for a change. Tim Lowe, Public Works Road Maintenance. Kyle Shippard, Fire Chief at the City of Manteca, writes, as the Fire Chief for the City of Manteca, I want to express my extreme frustration with San Joaquin County LEMSA. At your March 24th regular meeting, Director Birch made comments that, in essence, blamed Manteca firefighters for their exposure to the COVID-19 virus. He went on to say first responders were acting irrationally. These comments are offensive and very unprofessional. I would like the record corrected to show that my firefighters did not cause this exposure. I would like an apology to these firefighters who have been exposed to this virus and have put themselves in harm's way to serve the public. They do not deserve to be publicly humiliated. At a time when the entire healthcare system should be supporting each other, it is inconceivable that such comments were made. Please see the letter submitted by Manteca City Attorney John D. Britton, and that letter is on file with the Clerk of the Board's office. Another comment from Val says, why can't we work from home? If the job requires no inner contact with the public, I believe we should have the option from working from home. Phones can be forwarded to cell phones, and availability time can be the hours an individual is scheduled for work. Please consider, I think this option is a great one. And Amy Portello-Nelson writes, my name is Amy Portello-Nelson. I am a Stockton resident in District 3. I am happy with the shelter-in-place directives, but lack of communication around COVID-19 testing in this county are extremely concerning. Coronavirus testing is about disease control. It identifies an individual and limits the contact they have with others to slow the spread, especially for essential workers on the front lines. Testing data informs our decisions about subsequent actions, both for the individuals and for our community as a whole. Besides helping to reduce the spread, testing is needed to address the uncertainty in making decisions about patient treatment, resource allocation policy, and more. For weeks now, residents have been asking questions, and we need them answered. Where is testing happening? Are there countywide standards for who is being tested for COVID-19? Is it only those who are admitted to hospitals? How many total tests have been administered? Are the numbers of reported cases from public health as well as hospitals? When can we expect broader testing to begin? Other counties' public health websites have this information readily available. Ultimately, we know there aren't enough tests, but we need transparency about what we do have. There are brilliant advocates and willing community partners who want to step up and help. We understand that this is something the Board of Supervisors and Public Health Services have never dealt with before, but you must give us more information about testing, not just reminders to wash hands. Next comment is from Kenneth McCoy, an employee working at HSA. He says, my question to the board is regarding the stalled labor negotiations with county employees. Given the current public health crisis, I feel it is incredibly cruel that the CAO, seemingly at the direction of the Board of Supervisors, continues to hang the workers of this county who loyally serve their duties under these perilous conditions out to dry. The CAO's take it or leave it attitude is and has jeopardized the well-being of our constituents. Her cavalier attitude towards our nurses is already bearing fruits. San Joaquin County has half the cases of COVID-19 as counties such as Sacramento, yet we are matching them in numbers of deceased. Morale is at an all-time low in virtually every department and in every office. This is not how an employer should treat their hardworking employees, much less during a time of crisis when you need them to provide essential services. Throughout the negotiations, CAO has conveyed the message to us that we don't matter, that we're irreplaceable, that we should be glad to take whatever they give us, but now it's you who need us. We don't want to have or to strike or take more work actions, but I personally stand ready. Catherine Miller stated last week after ratifying the contract with IHSS care providers that, quote, this takes a lot of uncertainty away in a time when people are looking for certainty, end quote. A lot of employees are living with a great deal of uncertainty since our contract expired, and even more so now. I urge the board to do everything in its power to give the employees of San Joaquin County the fair contract they've requested retroactively. Their efforts during these times highlight how it is the least these heroes deserve. And Andrea Colavida Pinkham writes, I am a field representative for SEIU 1021, and I am a voter in District 3. To quote John F. Kennedy, quote, in a time of domestic crisis, men of goodwill and generosity should be able to unite regardless of party or politics, end quote. I understand that there is no playbook that one can open right now that provides us with all the answers or offers us clear, precise historical data. What I do know is that this is a time for us to come together for the good of our workforce and our community. If the U.S. Congress could do it, I'm confident that we can as well. I field calls all day long stating social distancing is non-existent at the work site. Proper safety protocols are not taking place, and staffing shortages are nearing crisis levels. When we reach out to county management for answers, we do so in a spirit of partnership. We are met with little or no response or disdain. We can do better than this. I know because I've seen us do better than this. Anyone currently working is risking their lives and putting the lives of their family in jeopardy. I acknowledge and appreciate the board for recognizing this fact and recommending a pay supplement. I call upon you to be men and women of goodwill and unite regardless of party or politics. If you do anything less, you are doing a disservice to your office and your community. Another comment from M.I. Zix writes, I have something I would like to say to the board. I'm very stressed out at HSA. I'm walking past people all the time and riding in the elevators with them. I don't know where they've been or who they've been hanging around. Every day is a new challenge because we don't know what someone did the day before. This disease is scary. You may not show any symptoms for 2 weeks. In that 2 weeks, you can infect dozens of people. I would feel awful if I infected someone, and God forbid, the worst happened. Thank you. Sebastian Nguyen from BHS asks, please tell us why BHS is exempt from HR 6201. Mental health is not a direct consequence of COVID-19. Marian Lindo writes, I have concerns about coming to HSA or going to see families without having proper PPE, such as masks or gloves. Please help keep us safe at work. And Zach Javon writes, good morning. Attached, please find a public comment letter regarding the state of the county's cannabis program and its importance in light of economic forecasts resulting from COVID-19. And that letter will be on file with the clerk of the board's office. And he further writes, the orders from both Governor Gavin Newsom and the county exempted essential businesses from the stay-at-home mandate. This exemption includes cannabis businesses all the way up the supply chain from retail to cultivation who qualify as essential businesses under the healthcare and agricultural business sectors, as formalized in subsequently issued clarification of the governor's order. It is also my understanding, per discussions with other executive level members of county staff, and in consideration of the protocols and technical infrastructure in place to facilitate board hearings, that Planning Commission hearings and board hearings may still be conducted with accommodations for remote public participation. Therefore, it is our request in recognition of the possibility that county resources and staff may continue to be reprioritized and marshaled to address the current COVID-19 health crisis, that administration of the commercial cannabis business program continues moving forward. Ultimately, with the downward trajectory our economy is facing, the ability of commercial cannabis businesses to continue to operate with enhanced safety, sanitation, and social distancing protocols in place, such as my clients with existing state-licensed operations in Stanislaus County, the cannabis industry has the potential to serve as somewhat of a buoy to our local economies. With the essential business designation in place, we are intent on working to support our community, our employees, and our families in any way we can through this difficult time. And Madam Chair Miller, that concludes the comments that I've received so far. I did just receive another comment regarding the golf course in support of keeping it open.
Okay, thank you.
Madam Chair, May I request that we read some of the, we have 80 plus people that wrote in a request for public comment on the golf courses. I think other than the fact noting that we have 85 plus, maybe we should at least read 5 of them.
I'm going to say let's wait until we get into our COVID discussion. I'd like to move on to our discussion items because we are going to be talking about this.
Okay, so keep those handy. Thank you.
Yeah, thank you. Okay, that's all the public comment we've received as of right now. I want to encourage any member of the public that's watching or listening, as the presentations and the discussion goes forward, if you have additional questions or comments, please go ahead and email them to the clerk of the board, and we will make every effort to read them and to get questions answered. So let's move on to our consent items. I'm looking for a motion, a second, and a vote to approve consent items 1 through 3.
I'll make a motion to approve.
Do we have a motion? Do we have a second?
I'll second.
Motion and a second. Please cast your votes. I'm getting a want us to just take a voice vote? Okay. All in favor, please say aye.
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 Anyone opposed? Any abstentions? Okay, then that motion passes 5-0. Thank you. Let's move on to our discussion item. The first one up is to discuss and receive an update on the COVID-19 pandemic in San Joaquin County and provide direction to staff or adopt orders as necessary. I think I'm going to call Dr. Park up here first, please, to give us an overview. Thank you, Dr. Park, for being here today. I hope you're hanging in there. I know you're working really long hours down there.
Thank you. Thank you very much. We continue to do our mitigation strategies at Public Health as best we can. The most recent numbers that I can share with you is that our confirmed case count is now 141, and we have 7 deaths. So we have added another death since yesterday, and I'm very saddened by the devastating nature of this disease. So as best as I can, I continue to try to get the message out there about social distancing. If you look at the CDC's mitigation tactics, there are categories for mitigation based on the level of community transmission you have, and it goes from low to moderate to high and sustained. And if we were to be doing everything that we need to be doing in the high sustained category, that would be to close schools, which we've done, restrict visitors to hospitals, which we've done, restrict visitors to skilled nursing facilities and long-term care facilities, which we've done, shelter at home, which the governor has done and we have done, and the list goes on, and we have enacted all of those mitigation strategies. And my fear is that it might not be enough, and I want it to be enough, and just wanting the public to know, and if I could use this forum to get the message out, that as much as we've enacted, if you could follow the rules as best as possible, really we have a chance to get ahead of our own curve and to try to make a difference. But as far as strategies go, nothing really new since last week.
Thank you. Dr. Park, can you tell us the number of cases? Is that still evenly spread throughout the county, every city?
Yes, the number goes up by about 10 every day, and there's some in each part of the county usually every day, and it's dispersed mostly along population density lines, so it kind of really goes along with where the populace is living as far as the disbursement.
Okay, but are we actually seeing cases from every city? I know if it's less than 5, typically it doesn't get reported, but I want the public to understand if this truly is across the county, all of our communities.
It most certainly is, and the numbers differ from city to city. We definitely have cases in every city. We might have cities that do have less than 5, and the problem with giving you a sense of security based on the low number is that these numbers are based on where people live. It's their residence. It's their documented place of residence. It's not where they contracted the disease. It's not the hospital they're in. They might even be in a different hospital in a different county. And so the numbers sometimes can be misleading, because I do know that there have been cases in every city, even if that person's residence was not in that city. So yes.
Okay, thank you. Are there any questions from the board for Dr. Park? Supervisor Wynn?
Yes, and I don't know whether you're the one to answer the question, but I do have, because we all get asked questions by the public, and there's a lot of media coverage of this across the nation, especially with the president and governors, et cetera. But when you talk about the COVID-19 surge, for example, and by virtue of staying at home, trying to flatten the curve, so to speak. But I'm not sure, and maybe I missed it, but we don't talk about numbers. I mean, everybody's talking about, what they expect as far as a surge. I mean, I know the Governor Newsom at one time said without any intervention that 56% of the population would be, affected or at least contaminated. And I know that's probably not the case, but I guess what I get asked all the time, and I'm sure others do, is one, how many do we expect based upon modeling? And I suspect we're doing modeling. The next question is, in light of that, how are we set up in regards to available bed space? And I have the figures as far as some of the availability of different hospitals, but so that's another question. And then the other question in regards to, obviously, the criticality of ventilators and personal protective equipment and all those things, but I'm not sure where we stand. Are we, I know nobody's prepared. I know everybody's been, taken by surprise by certainly the extent of this. But one, what is the expectation? When do we expect the surge to hit? Most are saying, probably 2 weeks, maybe 3 weeks. And I don't care about, New York and places like that. I'm concerned about San Joaquin County, but I don't necessarily, and there's a lot of information out there, and I try to follow it, but it's just voluminous, is where do we stand as far as anticipation of this surge, which is inevitable, and how prepared are we to deal with it at this current time, or based upon projections for future acquisition of bed space or equipment? So,
thank you. So, all very excellent questions, and questions that I've been asking myself. To my knowledge, the president has had many models shown to him. He doesn't say in public which those are, but I believe it's upwards of 12 to 15 different companies showing him predictive modeling. One of the resources that he's looked at has been the University of Washington's model. And the University of Washington released their modeling tactics and their actual models to the world on Saturday. And I think that was based out of some frustration that people need this information and weren't getting it. So based on the University of Washington releasing their models to the public Saturday, this is why you heard Anthony Fauci and President Trump on Sunday admit that they know that there could be as much as 100,000 fatalities in this country because the information was technically leaked. So if you look at the University of Washington's model, there's great variance, and there could be as few as maybe 40,000 fatalities, but as much as 200,000 fatalities. But they chose a line with the best mathematicians they could use, and the average and the best guess they have is 100,000 for the country. Now, the state of California has been doing the same, And just last week on March 25, I received a letter from the CDPH that they are using their own predictive models, and the governor's been looking at about 8 or 9 models himself. I'm sure University of Washington is one of them, but he's also been using the one by Penn Medical, and another one out of Great Britain called Imperial. All of these models show how your graph will go up, peak at a certain point, come down, and everybody's talking about flattening that curve. The model released by University of Washington shows that in California, the expected peak is going to happen around April 24th. But that's not specific to our county. It is all of California, and as you know, many counties are faring worse than us and started before us. So the surge, as you would hear in the news, is happening in 2 weeks. And a lot of people are using this word 2 weeks. That's because at the national level, the president is hearing that April 15th is peak day. Here at the state level, we are using April 24th as a peak day, the day that of the highest amount of admissions and hospitalizations on any given day is expected to peak. I do have county-level data from a company called Bayesiant by Mr. Charles Davis, and this is data that is very specific to our county only and based on our county's demographics. So knowing where our elderly live, comorbidities, children, where are the schools, where are the skilled nursing facilities. And I'm working with Bayesiant on refining and getting this model to look better and better the more data I give him. Started working with him about a week ago and sharing some of our data with him through a business agreement that we have with the county. And his predictions show that our peak are going to happen a little bit later than the rest of California, perhaps around May 11th. And I want to share with you that this company has been utilized by the state of California, the state of New York, and the state of Washington. Is quite reputable. But it being local, it has been offered to us. So I'm very fortunate to have that data. I can't guarantee to any of you that we have exact numbers and that we have an exact date. But my feeling is that the reason why I say we can still get ahead of this curve is because I've seen our curve. I know we're about to start going up that ramp, and we are now. April is going to get hard, and in May will be our peak. And so we are trying to prepare for that, and I am trying to spread that message out as vastly as I can for people to understand. If you look at Bayesiant's data, the numbers are alarming, but the numbers are based on having no mitigation strategies whatsoever. So at the peak on May 11th, the prediction is that we would have 919 hospitalizations, on top of that 367 needing ICUs, 183 needing vents. Now this is a total of 1,400 or so hospital admits on that day. But what I'm reassured with knowing is that this is probably not going to be our reality because our governor sheltered us in place when we were just at the beginning of having confirmed cases. And we sheltered in place, and we are trying to, as much as we can, practice social distancing and really spread that message. And by doing that, I'm hoping that we are below the predictive curve, which was done with no mitigation. I cannot predict how many infected people we will have, but the more data I give to this company, the more it will become refined over time.
So what you're saying is that's probably kind of the worst case scenario.
Yes. Yeah.
So based upon those numbers, which hopefully will be much less, where do we stand as far as being able to handle that type of load in our health system?
And I believe that's probably a better question for Dan, if he's here, as far as surge capacity and the numbers. I will say one more thing, though, about this predictive model is that the modeling started on March 23rd, and he marked it out every 7 days. And March 30th was a 7-day marker. And at first I was alarmed because the prediction was that we would have 60 people in the hospital on March 30th, which was yesterday, about 64 people actually. And I was alarmed because on March 25 I already had 77 positives. But the number of actual people who were in hospitals yesterday is less than that number, so less than 64. We're running at about 50% of our total who are in hospitals at this time. So it's a little bit of an encouraging news, but it's just one day in time along the graph that he has created for us. We are below the number of admits that he was suspecting based on no mitigation. So it shows that mitigation might be doing something, but we'll wait till the April 6th next point in time to really see if our mitigation is doing enough to keep that curve below the expectation.
So based upon that model, I'm assuming working with EMS and I guess the hospital, et cetera, we are being flexible in regards to adapting to what we see as the projection at that particular time.
Exactly, and as we get more data and give more data, we'll know more precisely when we are going to peak and what our surge needs will be.
Okay, thank you.
Thank you.
Mr. Birch, we're going to hear from you in terms of our capacity, because really the numbers really matter in terms of each region's or each county's capacity. The numbers by themselves don't tell the story. It's how much capacity do we have to deal with those numbers that really tells the story of what a surge is going to mean here in San Joaquin County. Am I correct?
Yes, Chair Miller, that you are correct on that. I have just a few numbers I think that I can share with the board that'll help you understand kind of where we are with our hospital system right now on the ability to accept a potential surge of patients that we're planning for. This is something that we've been planning for several years with our hospital partners. We have a catastrophic surge, patient surge plan that is updated annually with our hospitals and is exercised annually with our hospitals. So we have done preparedness for this, and I think our hospital systems are in a very good shape to handle what may come their way in an unprecedented situation. On a regular basis, on a daily basis, we have 1,220 hospital beds in our county. Licensed hospital beds. They're not always staffed, they're not always in use, but that's generally our licensed hospital bed capacity in the county. Our surge target is 2,232 beds, an additional 1,012 beds. We're working with our hospitals right now to exceed that surge target, and we're working with them on that. On a daily basis, we have 80 ICU beds. We currently have 22 available ICU beds as of yesterday's reporting numbers. We currently have 146 available medical surgical beds in our system. And total, and a lot of people have been asking this question, we have 207 hospital ventilators currently available in our county. 106, no, take that back. We have 207 total hospital ventilators in our county. We currently have 168 which are available for use today, as of our last reporting numbers. So when it comes to everybody's concerned about critical care patients and the ability to put them on ventilators, as it stands right now, we're in really, really good shape on that particular number. I'm very pleased to see that today in yesterday's reporting. We asked the hospitals to report their numbers to us on a daily basis. We get those before noon each day. So a lot of what I'm providing you is a day behind. My staff is already preparing the numbers for today's planning. One of the things that we're doing and have been doing this week, we've kind of caught up on our initial surge of helping all the hospitals with their PPE requests through the state. We're now doing advanced planning with our hospitals and working with them individually. This week we'll be working with them individually to see exactly what their surge targets are and how we can help them be able to succeed and build hospital bed capacity for our community.
Great, thank you. Any other questions? Supervisor Patty?
Thank you, Madam Chair. As it relates to the surge, anticipated surge, are you conveying and sharing all this information to not only the hospitals, but our first responders and all of the different districts and interested in parties?
Probably not as well as they would like me to, Supervisor Patty. That's one of the struggles that we've been having, is being able to have the time to make sure we can update everybody. I think this is why it's so important that we have this meeting today. I'm very appreciative of the Board of Supervisors for allowing us this opportunity to share our information with everyone. And as I think it's through these forums that we can best leverage our limited resources to keep everybody informed. Now that we're able to do a little bit of pivoting away from medical resource surging and into advanced planning. It's my goal to be able to share more information more quickly with our partners. The governor yesterday, I'm very thankful for him and his comments to the press and during his press conference, basically unshackled us on being able to release the numbers that I provided you earlier today, which I just shared with you today. He basically said, to a response to a question to a reporter, is this information available? And he says, absolutely, we will make it available. That unleashed me to start making more information available directly to you as policymakers, to our partner cities, and to the hospitals and first responders and others who need to be preparing for the surge.
Would you say that in the next 24 to 48 hours, you'll be able to provide the adequate information for them to be prepared?
My goal at the beginning of the week was to be able to have a very clear advanced planning strategy for hospital surge by the end of the week and know exactly where we stand with each of our 7 acute care hospital systems. I think what I would prefer to do is be able to brief the board next Tuesday exactly where we stand with that, because I think it's the board that I want to make sure I keep informed first and foremost.
If you've got hospital administration or people that are wanting this information, you're not withholding it. You just indicate that you're able to share it.
Yeah, no, we're talking with our hospitals on a daily basis. Dr. Park and I had 2 conference calls with our hospital leadership, both executives and chief medical officers last week, to talk about advanced planning, to share the advanced modeling that Dr. Park was able to produce, to encourage them to work with us to do everything we can to prepare our county. We're talking with them on a daily basis, and there's really no limit on the information that we can share back and forth between the hospitals and ourselves. It's whether or not the information is ready for public release is what we're concerned about. We don't want to inflame public. We don't want to worry the public unnecessarily. There's a lot of work that's going behind the scenes. I never want to get out ahead of any of my hospital administrators and release information that might be detrimental to them if it got out early. I want to be this in partnership. And so it does make it a little hard for us to share some information on advanced planning. As you can see from our public comments, there's a lot of fear in the healthcare workforce. I don't want to add to that fear. We are doing everything we possibly can to keep people safe and informed.
I would just contend that the unknown is also lends itself to more fear. If you know that you've got an anticipated surge or an anticipated capacity and workload, and you prepare for it emotionally and psychologically, that's, in my opinion, much better than the unknown tidal wave that's going to hit. So I would, as allowed, and if you're dealing with as you have your conversation with the JIG, I would encourage whatever information is available to share it, so that you've got people. It's not going out to publication. It's a closed circuit of first responders and people that are directly involved with the city. That representative from the cities that are participating in these calls to be prepared for this. So you'll be able to be forthright with them at least.
I share your sentiments, Supervisor Patty, and we're providing as much information as we possibly can to them, and I'm going to try to improve that level of communication.
Excellent. I appreciate that. Next, when you talked about ventilators, I've seen a couple of reports coming out of New York where they're stressed, of course, as many places are, for equipment, and they're doing double occupancy per ventilator. While it may not have been initially designed for that, the ventilators appear to be working and utilizing that extra capacity to serve double the number of people that are in need of a ventilator. Do we have any such plans of action?
Dr. Schaefer is looking on those issues. She shared with me just over the weekend, and during her research, there's a position statement out from and I'm going to get it wrong. I apologize. Dr. Schaefer's not here today. But there is a consolidated position statement from the Association of Anesthesiologists as the lead and others that recommend against that practice. And that's really the definitive statement that that's not a safe practice to do. I will always defer to the expert medical judgment of the physicians. That's their call on how to do that. And I think if something was to change, both Dr. Schaefer and Dr. Park would, working with the chief medical officers of the hospitals, that's their decision. And I'm letting them have that conversation, and I'm trying to stay out of that one.
Understood. Okay, thank you. That's the only question. Let's see if I have any other thing else written down. Yeah, I'd like to go back to more conversation with Dr. Park when appropriate, if everybody's done with Mr. Birch.
Yeah, I would, we have another supervisor that has some questions, but I would also like to, I know this is hard to balance, the release of information, but the statistics are showing nationwide that the more real information the public has, the more likely they are to embrace the stay-at-home orders and to really take the needed steps to help flatten the curve. So I know that's a hard thing to balance, but you can tell from the questions and the comments that we're all getting that a large percentage of the population in San Joaquin County really doesn't think it's that bad here, and they don't think it's going to get that bad here. And so I think we need to find that balance in terms of letting them know what the best science and the best medical advice and what the best modeling and what, you know, the very best actual facts are telling us that we're basing decisions on.
I agree 100%, Supervisor Miller, and we're doing everything we can to provide the public with as much information as we possibly can.
Great, thank you. Supervisor Elliott, you have a few questions?
Thank you. Yes, I agree with what was just said here about the difficulty we have is finding the appropriate balance. And we're taking rather considerable measures to keep people as safe as possible, to prevent the spread of the virus as much as possible. Yet at the same time, we need to try to allow folks to have as much of a normal life as possible at the same time. I mean, it is also adversely affecting people's health if they are restricted from doing some things which otherwise they would consider activities, and them unnecessarily restricted in so all of those things need to be taken into consideration, and I would just urge us to keep our eye on that as well in terms of providing the appropriate balance. We can never completely move the pendulum one side or the other, and I just don't think it's wise to do that. But one specific question I have here, we're talking about these models, and of course we want to plan for the worst possible eventuality here. Yet at the same time, on these models, it appears that they are intentionally inserting data which we know is not correct. If these models are based on the assumption that there is no mitigation being done, then we know the model's outputs will not be correct. So what plans are there to start interjecting real numbers into these models rather than the opinions of some that are based on numbers that they know are based on assumptions that they know are not true?
So the models are made differently by different mathematicians, and they're all lining up very well with each other, actually, on the Penn, the U Washington, Imperial. So it's actually quite amazing how statisticians and computational scientists around the world are creating models that are very similar. And this is based on population numbers for each area that they happen to be modeling. The R naught, which is the infectious rate, which is presumed to be somewhere between 2 and 3, meaning each person can possibly infect 2 to 3 other individuals. For our county, the model was made on an R naught of 2.71. That seems to be tracking along well with other models. If you go to the Penn medical model that they have, it's shared on the website now, you would put in your R naught, your rate of transmission, your areas, population, density, so on and so forth, with how much mitigation you think you're doing, 30% mitigation, 40%, 50%, and a curve comes out. Now, I don't purport to be a mathematician, but, you know, I do have access to these things, and I can tell you when I try to put the data in myself to this online site, it matches up very well with what I was given from our local computational scientists. So there is some science behind this. It's never going to be perfect, and I would say that from a public health standpoint, everything that we've done is 100% mitigation, and I would love that to be reality, but I don't think that that is reality, and I don't know what our mitigation rate really would be to plug into that number. As much as we have tried to have this county shelter at home and socially distance, it is, as Supervisor Miller said, people just don't get it. And they're still out there having picnics and parties and barbecues and sleepovers, and it's very frustrating for me because I want that number to not be 30%, but 40, 50, 60. And as you plug in the higher mitigation numbers, the curve does flatten on all of these models. So that is my desire, is that although I might not be able to give the exact number of people who are going to be infected in April or May, whatever that number is meant to be, I want it to make it as low as we possibly can. And that's the message that I really just need to use this platform to keep saying over and over and over again.
Okay, and that's a good message. So what you just said now, I think, is different from what you said earlier. Earlier you said these models are all based on the assumption that there is no mitigation being done. But now what you just said is, well, you do plug in some factor of mitigation based on your best guess.
Exactly.
So we are trying to interject some measure of reality into these models.
Definitely. The preliminary model that I got for our county was based on no mitigation. The numbers that you can get using some of these other tools that are out there, you can plug in a mitigation number. And I can share as much data as I can with the company that I'm working with and try to guess what our mitigation is. It's very unique because they're not only using all of the social demographics of our county, but they're also using what Penn does, which is called a Penn chime model. So incorporating some of that where you put in your demographics and your numbers and your R naught and your RT, but then on top of that, overlaying our own county's social determinants of health. So it's unique because it's got those two factors combined into this model, but we have not put in mitigation yet, so we don't have a mitigation curve for our county. But yes, throughout the world, people are putting in mitigation and showing how that would flatten the curve. So when you see that there's two curves on many models, one is without mitigation, and the flatter curve that stretches out over time is with mitigation. And I don't have that at this point. All I know is that if we were to flatten our curve out, it would mean that we would probably have the same number of people infected over time, but not have all the hospitals over impacted at any one given time. And that our surge would happen slowly, and we would probably end and come out of this crisis at a later date.
Okay, well, maybe it would be helpful to try to include that more complete picture of what the threat is and what we can do to combat it. Right now, if we're focusing solely on completely no mitigation, then we have artificially inflated numbers, which probably tends to give people less confidence in the numbers that they're seeing. If you could show them, here's what it is if people don't do mitigation efforts, and here's what it can be if people do the mitigation efforts, I think that would be a more effective message to get out to the people. So I'd at least urge us to consider doing that.
And if I can do that, I would love to have your permission to make that public.
I think we should.
I
Thank
think
you.
all of us would like to see that information available to the public
Very well. We'll be working.
on a regular basis, as often as you feel the public should see it, because I really do. I believe that the more people get accurate information, the more likely they are to buy into how effective mitigation can be and understand that it's up to all of us, that we can actually make a difference on this.
Great.
Thank you. Supervisor
On
Wynn?
that.
Thank you, Madam Chair. Let me go to Dan first, but I may ask you a question later, Dr. Park. I'm assuming when you talk about the expansion for the surge that we're looking at other opportunities like maybe outpatient clinics, room available within a hospital that can be converted with beds, et cetera. Is that basically what's happening?
Yeah, yes, Supervisor Nguyen, thank you for your question. Our base strategy is to expand capacity at our existing 7 acute care hospitals. As you know, this is a national pandemic. The ability for us to stand up a tent hospital really doesn't exist. We don't have the capacity to do that. We knew that, so part of our strategy from the very beginning was to make as maximum use of our existing hospital infrastructure as we possibly can do. And that's where our focus is with those 7 acute care hospitals. They have strategies, and we're working with them, and they have pre-planned strategies on how to convert all of their space into available hospital beds. Our limiting factor, if we have one going forward, which we're going to have to start tackling, is healthcare workers. And not just doctors, nurses, and technicians, but housekeeping and logistics and everything that keeps a hospital afloat, laundry service. We need a fully functioning hospital, dietary. Those are all the services that are necessary in order for us to expand services and do it safely to meet the patient's needs. And so that's where our focus is on, is how we can help those 7 hospitals. There is, and I'll go ahead and share this, maybe I'm getting out ahead of myself. Last week in discussions that Dr. Park and Dr. Schaefer and I had with our hospitals, Corin Harper from Kaiser Health Systems did tell us that they're looking at, for their own expansion, of how to convert the Stockton Medical Clinic into a 150-bed hospital. We haven't had an opportunity to follow up on that yet and see how that can come to fruition. But those are the sorts of strategies that not only is our office and public health working to implement, but it's up to those hospital administrators and those hospital systems to do what they know they can do. I cannot run a hospital. That's not my job. My job is to help them as best I can so they can succeed. And I need the hospital administrators and the chief medical officers of those hospitals to tell me what they need to succeed. And then I'll see if I can help them.
Well, thank you. You had mentioned, the kind of the military field type hospitals that you see in New York, for example. They have the hospital ship there. But I've also seen in one of the aspects of the New York experience is they've been using large facilities, convention centers, et cetera. And I appreciate that certainly the hospitals are working very hard to have the available bed space and equipment, et cetera. My experience with emergencies is you never want to underestimate one, because at some point in time you get overwhelmed even with the best intentions. And I guess my question is have we looked at other possibilities, and I don't want to throw out any names of facilities, but that are available with large space, large floor space with electricity and heating and air and all those other things, in the event that somehow our surge plan, is exceeded, that we still have a backup in regards to moving forward, because when we hit that limit, we're still going to have to treat patients, et cetera. So are those discussions occurring also with our hospitals?
I've just started discussions with Director Diederich on some of these strategies. One of the strategies that we're talking about, the hospitals raised it last week, and that we're looking and exploring, is what we call decanting. Where to discharge patients that don't require the high level of an acute care hospital but aren't ready to go home yet. That's what we're looking at potentially as being able to stand up. So I wouldn't say it's an acute care hospital, and I wouldn't say it's a skilled nursing facility. It might be something in between, where we could use an existing large building here in the county that we could convert basically into a low acuity hospital, that hospitals would have a place then to send patients that need rest and recovery, but not direct patient care hospital services. Those are strategies that we're looking to explore right now as we stand up our advanced planning unit, and working with the hospitals, I'm hoping that that's something that we can do. If we do that, we'd have to rely on some outside help. I wouldn't ask the hospitals directly to do that. They're going to be busy enough dealing with our most serious patients, and I want them focused on that if at all possible. We do have an existing core of healthcare volunteers that are registered and vetted and properly licensed that we may be able to lean on to help us stand that up. We may be able to reach out to our first responders. The governor has essentially given us waivers now for the use of paramedics and EMTs in alternate care settings and in hospital settings if necessary. I can reach out to speak with Director Duncan at the State EMS Authority on how we can maximize those personnel to stand up such a low acuity center with as many of the healthcare workers that we have available to us, whether it's from our own community or whether it's from resources from the state. If we get to that point, one of the things that kind of gets lost in the modeling is everybody's watching the national news, and even at a state level, is the pandemic won't hit all of California at the same time. So our goal is always to have a patient in the right hospital bed with the right physician and nurse. If, for example, Fresno County peaks tomorrow and is on the downward slope while we're peaking, my goal is to move the patients that require an ICU bed to available ICU beds in Fresno County or somewhere else through the state. It's called the state has a payment plan. And it includes including asking for federal assets to use our Stockton Metropolitan Airport to send people from Air National Guard to Wyoming or Montana or wherever there's an ICU bed that can meet their needs. That is a better plan and a better strategy and better resources for that patient than putting them in a tent in a field. If I have an available ICU bed anywhere in the United States that I can transport a patient to, I want to transport that patient to that ICU bed and that physician.
Well, that makes sense. I don't know what it is now, but I know Stanislaus County in the past has been a much lower rate than San Joaquin County, and they have, two level 2 trauma centers, et cetera. So I think that makes sense. I guess the other part in regards to, you talked about the ventilators, and Supervisor Patty raised the issue of splitting them. But there's other, I guess, types of equipment that can be converted. Is that also being looked at in regards to increasing our numbers?
I'm sorry, Supervisor Nguyen, I lost track of your question. I apologize.
There's, I guess, anesthesiologists, maybe this is what Supervisor Patty was talking about, but apparently there can be certain types of equipment that can be converted to a ventilator. And the question is, are we looking at that, or the hospital looking at that to increase the numbers that would be available for future surges?
I don't have an answer to that particular question. My office has not been exploring that particular avenue. I'm not sure if Dr. Park has had those conversations, but that is something that obviously that we can look into, but we have not to this time.
I know that Governor Newsom is trying to get some old ventilators refurbished, but I'm not sure about any local efforts, but that should be dispersed.
Yeah. I would like to just share with the board, in 2008 and 2012, as part of our surge strategy, we forward deployed as a county 42 medical ventilators to our hospitals here in San Joaquin County. So part of the hospital, when they're reporting available ventilators, some of those are the ones that the county purchased through our grants and made available to those hospitals.
Well, I appreciate that. Probably Mr. Culberson has probably a more accurate response.
Yes, Supervisor Nguyen, through the chair. Yes, we have, I think, in the community here, some very, very entrepreneurial, very innovative anesthesiologists that are reaching out. And I know at San Joaquin General, they've taken a look at other opportunities, and I think their colleagues nationwide. CPAP can CPAP be modified to be more of a respiratory support mechanism rather than just an augmentation system, and I think that's something that they're getting guidance from the CDC as well as their professional societies. And as Dan pointed out, we have located some additional ventilators that have come into the county. They are, I know at San Joaquin General Hospital, they're being preventative maintenance is occurring to them, so we will increase our capacity by about, I think we used to have I think will be up to 35 that we'll have on site. And then we have additional requests on to Dan through the MOAC, as well as EMSA through the MOAC, as well as trying to find some additional vents that might be available commercially. So those things are available, and things that I think that the respiratory and the anesthesia community are really trying to add additional non-ventilator capacity.
Okay, thank you. We all get asked questions, and I've made a list of questions that I guess. I was taking my garbage can out last evening, and I barely got through the gate when I was approached by a walker. And by the time I was finished, I had a mini town hall. And so my point is that everybody wants to know what's going on, and you are all the experts to provide that information, because I can't provide it. I'm asked questions I can't answer. And I think sometimes people think we, as supervisors, know everything about everything, and we don't. And just what we've heard so far this morning has been a great help, because I think we have a better opportunity to assure our residents that we are doing things. And I think, Supervisor Miller touched upon in regards to information as opposed to no information. I think Supervisor Patty also talked about it. I think one of the values of getting this information out is when people know what's needed, they step up, whether it be businesses or individuals. And I think we need to provide them. I understand the concern about, raising fears and people becoming, deathly afraid that, somehow they're going to be contaminated. But I think really most people, they just want to know what the truth is and what's going on, and they can react accordingly. And I think probably with Dr. Park and certainly her concerns, I think if they have information, they will probably be more responsive to follow these orders, because they know what's happening. And right now, there's just that lack of information, and they look at the news and look at New York and things like that, and we're not New York. So these are things that I appreciate. There's two things. I know that Ford Motor Company and General Electric Health are promising to build 50,000 ventilators in 100 days. And I guess it's an oxygen-based as opposed to electrical-based system. But things like that, and the other part is, I know that Abbott Labs, I guess, has been approved with the Food and Drug Administration in regards to this test that will provide a positive result within 5 minutes and a negative result within 13 minutes. And my point is that what kind of I assume we're reaching out, we're trying to acquire all this equipment, et cetera, and certainly increase our bed space. But what are we doing in regards to some of this technology and some of these testing procedures that are going to be available in the near future? And they're talking about millions of these tests, and how simple can it be as far as providing this opportunity to put it in this small device and have a test very quickly? Just a question, because I don't have any answers.
So thank you very much. And Mr. Culberson is going to be talking about their attempts to get their hands on the Cepheid brand rapid test. And the Abbott brand as well, just recently approved for testing as a rapid test. That's all in the news, as well as serology antibody testing. But to actually get your hands on it is difficult, and for someone to take the lead to try to get their hands on this testing is difficult. The actual benefit for testing, obviously, if you test more, you're going to know more of your real data, and the more people who are positive, the more you can isolate. And perhaps there's still some chance to isolate people who are positive and stop the spread that way. But really, as we move further into this pandemic, the real value of testing at this point, since we weren't able to do massive testing at the beginning, is to see who's maybe now had COVID, has an antibody that shows that they had it, but yet they weren't very ill at the time, but they have some conferred immunity, and it would guide sending people back to the workforce. So there's value in the antibody testing because you could decide who goes back to the workforce. There might be some value in the rapid testing because you could decide who to take out of the workforce and be more aggressive with that. And Dave, you could talk about the Cepheid.
Yes, Supervisor Wynn through the chair. San Joaquin General was pretty early on attempting to obtain this recently approved COVID test from a company called Cepheid. It's CEPHID, and their website is up and active. And we've placed a purchase order, I believe, early last week, and we're trying to get delivery for early this week. We've been in contact and basically told that although the technology is available, the units are going to go to the high impact areas. I mentioned specifically New Orleans and Detroit as places that are having much greater impact that testing would be required relative to us here in our county, and we're told that maybe we'll be lucky if we can get it in May. So I think we are dealing with a distribution channel for new technology. We are a very, very solid lab with Abbott. We have a very, very advanced automated system that we've been working with Abbott for a number of years. We will pursue that test. I did become aware of it, and Dr. Mohan and Cecilia Mui, our lab director, will pursue that. But again, I think we're anticipating that the early adoption will go to the very, very heavy, large urban areas first.
I have to add that at a city level, Mayor Tubbs has reached out to the folks at the California Department of Public Health and Cal OES, as well as the Verily Group, and they had a conference call, and that seems to be moving along. So Verily is that group that Governor Newsom has talked about in his press conferences. What they do is they have an online screening tool. People can get online, answer questions as far as their symptoms, their history of travel, any history of exposure to a positive confirmed COVID. Are you a healthcare worker? Are you a first responder? And it's a tiered system where then it spits out a yes or a no. And based on whether you're allowed to get testing, you can then go to a drive-up site here in Stockton, roll down your window. As long as you show up within 3 days, you show your ID, and they will do the testing. This was started in Santa Clara, which, as you know, was hard hit from the very beginning, and then it seemed to work fairly well, and so they took it to San Mateo, and more recently Riverside and Sacramento. The company stands up its own process and its own drive-through area, and was supplying the testing supplies such as the swabs and the viral media, and that really is the limiting factor. The state is very interested in doing this here in Stockton, and perhaps can be used county-wide. And not only is the state very interested, but the people from Verily are very interested. So the limiting factor is getting those swabs, and Mayor Tubbs is working on getting the test supplies. And he's had some promising contacts made, and it looks like it might be happening. So another avenue to get more testing done.
If I may add to Dr. Parks through the chair, San Joaquin General Hospital continues to operate on a fairly regular basis, Monday through Friday, and then a half day on Saturday, a drive-up testing site. We do require a appointment, and the reason is we just don't want asymptomatic patients coming up and showing up because they are concerned that maybe they were exposed to somebody at the grocery store. But it's a screening the screening questions are fairly basic. Have you been around someone that might be positive? Do you have breathing, shortness of breath? Do you have a fever? Do you have a cough? And then if you're answering yes to that, and that's all done over the phone, then we'll go ahead and we can get you in the same day. But we do require appointments just for a little bit of, again, social spacing as the cars come in. We do have the outpatient clinic assistant and the family medicine team are there ready to greet you at the door. It's right by the main entrance to the outpatient side. I'd call it clinics 5 and 6, right there, the main entrance into the outpatient center and French Camp. So that is available. I'm happy to report we really are getting great turnaround time for emergency patients, for inpatients, and our employees through public health. And as of this week, it does seem that the large commercial lab that we use, Quest, is turning around their results much faster. So then there was experience of up to 7 days delay. I think actually it's down. I was reported yesterday it was around 2 days. Much better then. So testing is available. I don't know of other test sites that are running in the community, but again, it's something that we do offer at San Joaquin General Hospital.
Thank you.
Good morning, Sienna Blackwell Rodriguez, Public Health Director. First and foremost, I would like to publicly acknowledge and express my gratitude for our laboratory team, our COVID response, disease control, and prevention team, and our DOC staff members who have been working tirelessly, 12-hour shifts, 7 days a week for over a month and a half now. So as far as the public health laboratory, we have currently, I would like to remind you that we are a regional lab and do testing for 8 other counties. So as far as COVID testing, we have run a complete total of 673 tests. 473 of those were from our county in particular. 41 of those were positive, and 39 of those 41 were from San Joaquin County. We are able to run 60 tests a day, which is actually an increased capacity in comparison to even Sacramento County. We have a surge capacity, meaning that if we stop all other business and testing, that we are able to run up to 144 tests a day. So our turnaround time is also very impressive. We are averaging less than 24, but no more than 24.4 hours in resulting those tests.
Just a quick question. Are we able to meet the demand for tests in this county?
At this time, we are. All of the tests that we're getting, we have, like I said, the expanded capacity as needed. Right now, we're running 2 batches a day, so that's totaling 60. On some days that we do get further tests, we do run a 3rd batch, and like have other machines in the event that we need to surge, and so we can run up to 144 tests. A lot of people are sending to commercial labs such as Quest because we do need to prioritize the public health laboratory to support our county's healthcare system.
Thank you.
Thank you. Supervisor Patty, you've been very patient over there.
Thank you, Madam Chair. A couple of questions, might be for Mr. Birch if he comes back up, or Dr. Park, or whoever's available. But since we don't quite know, it hasn't been revealed the anticipated surge and the demands, does the county have enough beds and ventilators to meet the projected needs of any such demand?
I don't think I can get a definitive answer for that right now. If we will, it all depends on the patients that we receive, but we are on excellent trajectory to be able to meet the current demand as I see them. If the worst case scenario happens, which I don't believe it is, I think the mitigation strategies that the governor and that has implemented statewide and that Dr. Park has implemented locally are working. I really do believe that. I think we'll be okay. But I need a little message out to my 7 hospital administrators. I need them all to take this seriously and work with us to expand capacity. There's some really excellent hospitals out there that are above and beyond and are well ahead, but I still have 200 portable hospital beds sitting at my warehouse that I can't distribute because the hospitals that they're earmarked for won't take them. I need them to step up.
Okay. Thank you. Appreciate that. I'd like to also bring back maybe through the chair, Dr. Park. I'd like to chat with her a little bit about a few things. I know that we've, in the very beginning, the idea was for us to emulate the South Korea model, which leveled off rather quickly. There's a quick curve, and they leveled. And as we just talked about, testing seemed to be the one thing they did very well there. And I know we've touched on that issue. My concern is that or first to echo what the board has said, I think the value would be incredible value to give a best case, worst case scenario so that the public can be aware of how important it is for them to engage in the safe practices that will keep us on the low end. And if they don't, then we'll be on the high end. And this is how bad the high end could be. So, that modeling on the best and worst case scenario would be very valuable to the public as we've all intimated and support this county sharing that information to the public. I spoke with you yesterday, and I know that this has been an issue, and I'd like to read on record some of the many public comments we have regarding golf courses. Do we have any data that indicates that people have been exposed on a golf course and are now in care at the hospital because they've gotten coronavirus based on the lack of practicing social distancing?
I don't have any data on that. I do know how many people who are in care have had no actual contact or exposure history or travel history. So community-based transmission numbers I do have. Specific to golf, that would be impossible to know.
And is there any pattern of where we are seeing how people are getting infected? It's indoor activity, it's exposure to travel, it's cruise ship, it's, I would think there's greater risk if you're in close proximity and indoors versus if you're outdoors. Is there any data on that?
I don't have data on indoors versus outdoors. We have data on who's travel, we just have data on who's person to person, and we have data on who's community. And a lot of cases that are still under investigation where we don't know the mode of transmission.
So far, what is indicated what's a commonality? Is there any parameters that you'd identify? I've heard senior citizens a certain age. I've heard people with respiratory issues. I know that there's also some examples in people that have been young, very young, in their 20s as well as infants. So there's a broad spectrum of risk. But are we seeing any type of pattern we can identify? This is the type of person that needs to be extra cautious.
The pattern mirrors the pattern nationally, which is that children are at least risk. And out of the numbers that that I shared with you this morning, only a handful are children, less than 18. The rest are adults. And that's scattered throughout the adult age groups. But yes, definitely it is the older age groups and those with comorbidities who are dying.
Comorbidities, please explain what is that?
Cardiovascular disease, lung disease, diabetes, immunocompromised.
Okay, so if you have cardiovascular disease, if you have diabetes, if you have, please repeat what else?
Chronic lung disease.
Chronic lung disease.
Or an immunocompromised state.
Okay, then that's where there's a higher risk of contracting or a higher risk of
having a severe outcome.
Of a severe outcome and mortality. Okay, thank you. So I spoke with you yesterday about this, and I would guess now is the appropriate time to discuss. But there was an action taken to close golf courses in public outdoor areas as available to the public or private, for that matter. And it's a little bit concerning. I have 3 golf courses directly in my district and across the street from another in an adjacent neighborhood. That's so 4 effective golf courses that people I represent are inquiring to me as to the methodology and the reasoning and the justification for closing down golf courses. And as we discussed yesterday, you have the state capitol where these laws are being written, where the governor resides, and all 9 of their public courses are open, and all 5 or 6 of their private courses are open. So I'm having a hard time justifying and telling my constituents why we need to close San Joaquin County golf courses.
So I cannot speak to why Sacramento has not closed their golf courses, but I know that many other counties have closed their golf courses. It is not on the list of essential activities issued by the governor, and I did confirm with people at the state that is not considered an essential activity.
Who exactly did you speak with at the state?
I have communication with the Deputy Director of the California Department of Public Health, and moreover, I spoke directly on the phone with Dr. Sonia Angel yesterday. She is the Public Health Officer of the state and the very person who signs the governor's order to shelter at home.
Yeah, would you send to me their contact information so we can follow up? I'd like to read into record. I've got a letter from our Assemblyman, Heath Flora, who has spoken with people in Sacramento as well, as he represents part of San Joaquin County affected by your order. So, and by the way, let me state for the record that I don't, for a moment envy the position you're in. It's very difficult. This is a lot's resting on your shoulders, and this is not, anybody ganging up on you or anybody else. This is an incredible burden that when you signed up for this job and when you're here and you're in an interim position, you haven't even, said, this is the job I want, as far as I know. And it may be, I don't know. But you do an outstanding job looking out for public's concern. And I want to recognize that and not for a moment dismiss the magnitude and the pressure and the responsibility you have. And I think, by discussing with this board and allowing and giving out some of the information to the public, we want to rally behind what we need to do to mitigate and to, cap this off and get on the downslope of this. So, that's absolutely, that's where I'm coming from.
I appreciate that, Supervisor Patty. It definitely is a difficult time, and it's not easy to make any of these decisions, so I do my best to go with what the state has given me and what the governor is trying to relay through his messaging. I don't take pleasure at all in closing any businesses or golf courses. It's not my intent to make people unemployed or to have people not enjoy the sport that they love and the sunlight and the fresh air. But there are other means right now of getting your fresh air and your sunlight other than golfing. And my duty is to protect the public as much as I can and their health. And so the reality is that even though you might think that people who are golfing are 6 feet away from each other and are not social gathering, there's no way to guarantee that. There's no way to guarantee that there won't be 2 men from 2 different households who are driving to a golf course to meet and golf together and will stay within 6 feet. I just can't have that as a guarantee from all the county golf courses, no matter what. And I don't feel comfortable saying that that's an essential activity when we have already terminated faith-based services from being able to gather. The state has actually closed all state parks in relation to this sort of social distancing maneuvering, and we're telling tons of home-based and private organizations to close and small businesses to close, and it's just another way of trying to do extreme social distancing. And it's obviously not comfortable for anyone, and certainly doesn't feel natural that we can't go out and hug each other or shake each other's hands, but that's the extreme measure that we need to take if we're trying to flatten this curve. And my problem is not everybody in the county understands that, and I really want people to understand that. And what Dr. Angel told me herself is that people who go golfing are usually the seniors and the people with comorbidities who are already at risk. The governor has shut down all state parks, and in relation to that, we do believe that golfing is non-essential. It goes along the same line of thought. This is a time unlike any other time, and of course, although we feel it's natural to socialize, this is not the time to socialize. The directions for mass gatherings has been very confusing, I think, and I want the public to understand that we are no longer at a point where we were just a few weeks ago, where we said a mass gathering was 250 people or more. That went out the door literally a week later, when we then said a mass gathering was any gathering of 50 people or more. Now, I think people are getting confused because President Trump is saying that a gathering can be made with 10 people or less. And the postcards are going out to every home in the United States. Don't gather with 10 people or less. That is not the case here in the state of California. We have, out of this country, the 3rd highest number of confirmed COVID cases. We're not at 10. We are at 0. By direction of the governor, a mass gathering of any size is prohibited. So you can walk your dog, you can run in your neighborhood. You are advised not to get in a car to go to a golfing range or to go to a park. You are advised to try to stay close to home with the nucleus of people who live in your household. And that is the part that people don't understand. They think it's okay to hang out with their friends on a Friday night for a drink, have people come over for a birthday party. It's not the case at all. Our mass gathering number right now for this state is 0.
Dr. Park, respectfully, we have thousands of cars going over the Altamont every day, going somewhere to the Bay Area, thousands of cars. There's still traffic reports in the morning. So people aren't staying home. And I don't know even where they're going to over there. But what troubles me and what's problematic for the measures that you've taken is that you didn't even give it opportunities for these golf courses to comply. I mean, I've got a checklist right here from the National Golf Course Owners Association. There's almost 49 or 50 points of action that golf courses can and are taking throughout states, throughout counties, throughout cities, municipalities, public and private. Golf courses are enacting these measures. If you read these measures and adopt them and say, if you want to follow these provisions, there's 0 contact. We've got a picture.
They're writing me letters as well and receiving some of the same letters that you're receiving.
Just to finish my point. There was a picture, Supervisor Miller, our chairwoman, her husband was on Swenson's golf course last week when we talked about this, and there was a picture of him, and there was nobody around him. And he was wide open. He was practicing safe social distancing. So people can be on a golf course and be with extreme distances. I'm assuming, I don't know for sure if it's not.
On the course.
He wasn't? Okay. Well, whoever it was, there's people at Swenson's golf course that had, and I'm saying it in a complimentary manner, but there's people that are practicing social distancing. And it's easy. Golf courses have marshals. They ride around. They make sure people stay clear. They've removed the ice boxes. They've taken out the flag sticks. They've taken away the rakes. You don't share golf balls. You don't share equipment when you're golfing. So there's a myriad of measures that could be taken. Right here is almost 49 measures that are recommended, and there's
Yes, and I
states
appreciate your
across the
attempt
country
to
that are
get
utilizing
that
this.
solidified for these folks who do want their golf courses reopened. If I were to say golf courses can enact this myriad of 50 measures, and if they promise to do that and follow my policy, they can reopen, I would have to do that for churches. I would have to do that for parks. I would have to do that for everyone, as long as I said, follow my policy and do social distancing. That's not the aim that I have right now. It's exactly the opposite. I am trying to move us into extreme social distancing, as extreme as we can make it, and try to make people follow the law and understand the law. I've already received a direction from the people right at the governor's office. Doesn't matter what the County of Sacramento is doing at this point. I'm receiving direction from Dr. Sonia Angel herself. And so this will remain the same. I'm not changing my shelter at home order to now disinclude golf courses.
I think your measures, I disagree with wholeheartedly. I do believe that while you have a responsibility, I think without giving businesses operation, you, on your shoulder, are taking on a burden of responsibility and creating economic hardship for people that work at these country clubs, for husbands and wives or families that want to go out and recreate, that pay for membership, and you're creating an undue burden. And I believe these actions are absolutely draconian.
I would hope that those people, if they gave it some thought, would realize that I'm actually trying to protect them. I'm trying to protect them from the asymptomatic people that are walking through these areas and have the possibility of me giving them exposure without even looking sick. That is how social distancing works. That is how this pandemic is spreading. And if you gave it some thought, they would possibly realize that it's for their own good that I'm doing this. I have received the same letters that you are receiving, and I've also received letters from employees of golf courses thanking me because they felt that their lives were at risk.
Well, then they shouldn't work there if they don't want to work somewhere. But I've got letters from people that are asking to work. That are saying that how the necessities, so the economic hardship and burden that's being imposed is unnecessary. If you haven't given at least the opportunity for them to operate within safe guidelines. So I'm going to challenge you with the people you said you've spoken with, because I've got our Assemblyman, Heath Flora, who's spoken with people up in Sacramento, and they say it is not the governor's intention for golf courses to close down. And I would say it's evidenced by all of the golf courses in Sacramento where the lawmakers reside and preside. I'd say that that's a great example. If all of those public and private courses can be open, but yet we have to close ours. You got people who live on a golf course. They can walk out their back door and golf, and you're saying, no, they can't do that. You got husbands and wives. You got families that are cooped up. The mental, you're, as a doctor, what about the mental and the emotional anguish that's caused people have to just coop up and indoors? You say they can't even go to a park? Can't go outside and sit down on a grassy area?
Excuse me, Supervisor Patty, I'm going to call you on this now. You started out by saying that you appreciated Dr. Park doing her job and nobody was going after her, and you've now spent the last 5 minutes going after her personally. So we're not going to pursue this any longer. Appreciate the fact that there's a lot of folks in the county that might disagree with Dr. Park. But Dr. Park is our chief medical officer, and we're not going to attack her anymore personally. No member of this board is going to attack her personally.
Well, Madam Chair, it's not a personal attack, and thank you. I respectfully understand your position. And Dr. Park, I am not personally attacking you. It's the position that's being taken. And I know, as I said, I recognize the burden that you have. But I'd like you to reconsider, and I will take this issue up at the state level so that our assemblymen can speak with the people you've said you've spoken with, as I'm sure you have. But maybe we need a little more clarity on this, but I do not think this is fair.
Thank you, Supervisor Patty. I'll end it here by saying that I'm not going to reconsider, but you are free to contact the governor's office if you choose to do so.
Absolutely. We have some questions from Supervisor Wynn.
Oh, yes. This is Dr. Park. You can sit down. I'll just make some comments, and you can respond if you'd like. I understand Supervisor Patty's concern. I think we've all received the letters and emails, and actually people knocking on my door on their way home from the golf course. Anyway, but I have a kind of a bigger question here, because, and I know this is just an arm of the federal government. This is from the Department of Homeland Security, and this is the cyber infrastructure arm of that, and talking about guidance on essential critical infrastructure workforce. And I suspect may be different than other government agencies, both the state, et cetera. But it does say that, I'm just reading this because it does provide some latitude for local governments, and it may not apply specifically in this case, but I think at least the wisdom of it is appropriate. And it says that this list is, and talking about essential critical, this list is advisory in nature. It is not, nor should be considered a federal directive or standard. Additionally, this advisory list is not intended to be an exclusive list of critical infrastructure sectors workers, functions that continue during the COVID-19 response across all jurisdictions. Individual jurisdictions should add or subtract essential workforce categories based upon their own requirements and discretion. So that's just kind of a general comment in regards to flexibility. The other part of it is that it's not just the golfers. I mean, it's the business itself that is affected. And the golf course, I have 2 golf courses in my district, but the one specifically that I think Assemblymember Flora was talking about, and I've talked to him also, is that they do provide some very strict guidelines for their members. And it does talk about a number of things that Dr. Park has alluded to in regards to social distancing and certainly the cleanliness, et cetera. But there's another aspect, because it is a business, and businesses in this particular period are struggling. Obviously, we've seen a lot of them probably close and never come back. Spring Creek in Ripon has about 120 acres for its 18 holes, plus its clubhouse. And also, they have 12 employees who maintain those. And as we all know, golf courses, probably the major financial investment is their landscaping. And I guess the question arises, if the golf course is closed for, let's say, at least a month, maybe 2 months, that particular facility will require $100,000, probably millions of dollars to recover from it. And I'm not an expert. I just know how grass grows and weeds, et cetera. So the question arises is for example, I had a landscape gardener contractor contact me, and his question was, can he continue to do his business in servicing residents, et cetera? And I said, well, I said, it doesn't specifically say. I said, you're probably the closest you are, and this goes back to individual supervisor making their own interpretations. I said, I would put, your job akin to almost agriculture, because you're out in the open, you're mowing grass, you're trimming weeds, et cetera. And oftentimes there may be 1, maybe 2 at the most who are working on a particular residence. I said, I would say, until somebody stops you, I'd say go ahead. And that may have been wrong. Maybe it's not according to guidelines, et cetera. But it did happen. And I also had heard from another one that they felt that they should stop or be fined for their actions, for their business. And but I see landscape contractors all over the place. And essentially doing the same thing. Yes.
Thank you, Supervisor Wynn. And that's a tricky question. And when I brought that up with Dr. Angel yesterday, she said she would move that question up to the state lawyers. So that question, as far as maintenance of golf courses and the grounds, is now with the governor's lawyers. And I will get back to you if I get an answer with that.
Okay. Well, I agree with that. And I guess the reason I bring up the whole issue is kind of in a broader sense, and maybe Mr. Miles can enlighten me, but I certainly appreciate your role. And as Supervisor Patty says, I know it's very difficult because there's a lot of, as all of us get up here, there's a lot of pressure from different sides on what we should decide. But on the other side of it, I think it's also important that with businesses, and I know there's a lot of talk nationally in regards to not just the health crisis, but the economic crisis that is unfolding. And I guess I would hope that we can make health a priority, obviously, for our residents and our employees. But on the other side of it, I think we should also look at the possibility for opportunities to allow businesses to stay open, even if it's a minimal amount of time. I know residents in my city are starting to purchase meals from businesses that only have takeout now, and to keep them alive and going until this is over. So I understand, and I guess from Mr. Miles, the question arises is, I assume that the public health officer is the final authority, or does the board have any discretion in regards to some of these directives that come out of her office? Just a question.
The public health officer is the final authority on her orders that come out. I reviewed the statutes this morning, and the statutes are specific in giving her authority to adopt orders to address these types of situations. I will add that throughout the past 2 weeks, we have received a number of inquiries from the city attorneys are contacting me, and we go through a process. Every time there's a question about can this business operate or that type of a business operate. So you raised the list that was published by the Crypto Security and Infrastructure Agency, Department of Homeland Security. That generally is a list of guidelines to indicate that's published by the federal government. On March 22nd, the public officer issued a specific list as part of the governor's order, and it includes those sectors that are identified on the CISA Essential Critical Infrastructure Workers list, and the state also modified that list to add additional categories. That as part of the order, counties, because of the sovereignty of the state and because counties are an instrument of the state, counties are required to abide by the state order. We can be more restrictive, but we cannot be more lenient. When we receive those requests, I go through an analysis, and I also have staff in my office who are looking at these as well. And we look at first the specific language from the governor's order, and then the specific entities and types of work that are identified on the March 22nd order from the public health officer to see if the category of work fits within any of those categories, with any of the listed categories. And there's about, I believe it's 14 pages of types of work that the state has deemed as essential. Agriculture, manufacturing. We go through that list, and then I prepare an interpretation of it, a response to the question, and I provide that to Dr. Park, and I consolidate them throughout the day so I'm not pinging her with emails throughout the day. And at the end of the day, I send her a document that has all of the questions I've received and the proposed answers, and then she weighs in and says, I agree with this or I don't agree with this. And then we push those answers. In some instances, I've pushed them back to the cities so that they could respond, and in other instances, we've published them on the county FAQ.
Yeah, I appreciate that, and I guess, but here's my observation, because, as I said, when I was just out there initially for a few minutes, I was out there for half an hour. But as I was there, and my wife and I, we also take walks in the neighborhood, and actually we walk over to the golf course, and et cetera. But my point is that there's a lot of people out walking. I mean, they are, and it says in our order, this is the one that Director Cunningham has signed, it talks about in the, I think it's 9 or maybe 9A3, it says to engage, let me read the preface. It says, essential activities are limited to the following. And then it talks about activities, perform tasks, health and safety, et cetera, which you're talking about. And then necessary services supplies. Then it says, number 3, it says to engage in outdoor activity, provided the individuals comply with social distance requirements as defined in the section, such as, by the way of example and without limitation, walking, hiking, biking, running, or equestrian activities. And then the latest version puts in bold letters, do not use park or playground equipment, which I clearly understand because of the contact. To me, and I'm not a golfer, so I can't profess this, that maybe some others on the board are golfers, but I have a 3-page list of restrictions that, and I was sent this, but because the chairman of the board of directors knocked on my door and discussed this with me of the golf course. But it does list a whole bunch of preventing measures to make sure, for example, anyone in a high-risk group, i.e. over 65 with underlying medical problems such as heart disease, diabetes, cancer, lung disease, which I think Dr. Park had alluded to, all those, critical areas, compromising immune system, should be extra cautious about social distancing and seriously consider staying home. So that's basically their premise. It's critical to continue practicing social distancing both on the golf course and around the club. And essentially the club is closed, and then it talks about only one passenger per car is permitted. And then after that, it says walking is encouraged instead of riding. And it is, as Supervisor Patty had alluded to, there's pretty much no touching of anything by members. And I guess my question is, and I certainly appreciate Dr. Park, and I know where you stand, and I know you have a challenging job, but in my mind, and I look at things very simply, and watching golfers, and they usually keep their distance between holes, so there's not a lot. But I guess my question would be is if we were, maybe Dr. Park or County Council Miles, could look at this list, and I only provide it as an example, not as the gospel, and I'm sure other golf courses have similar rules. But at least evaluate this and just look at it and see if there's anything in here that certainly provides, you with some insight as to, whether it is clearly a hazardous activity by virtue of the potential contact, or that there's an opportunity, if you follow these rules, that you maintain your social distancing. Whether you're walking down the greens or you're walking down the street, it's all the same for me. But I would at least ask that, and then obviously the next question is, if Dr. Park, and I would encourage you, if you have time, and I know you're busy, or have staff, but at least look at this, or maybe County Council should look at it. I don't know where it would go to.
I'm happy to take it, and I'll have a discussion with Dr. Park. The other part of the analysis that we look at, and that we looked at specifically for the golf courses, is not only on one side do you have the participants and the anecdotal evidence or the reports that we got of that while there were recommendations, or while the clubs were saying only one person to a cart, that it wasn't being enforced, and that people were not abiding by the social distancing. So that's one half of that equation. The other half of the equation, though, is the employees. And in reviewing the state's order, I have not been able to identify a category that the golf course maintenance employees would fit into that would exempt them from the overriding order from the governor, which is the stay-at-home order.
Well, I understand. Dr. Park had talked about, discussing the landscaping part and things like that. And I think if that were approved, I think golf courses falls in the same category of landscaping, maintaining, grass and trees and those types of things. Again, I understand the in this particular case, it was actually the police department that came out. So, this is kind of harrowing from the standpoint of a business where the uniformed officers show up and close down a golf course. But I would also say for the city of Ripon, they take it seriously. So that's part of the process of mitigating the potential for this. But I do think I would ask that you look at this because, again, and I think we all know that when you get at a higher level, whether it be certainly at the county level from a city or the state, and certainly the federal government, you're looking at things from a much higher perspective. And oftentimes, it's kind of I don't want to say one size fits all, but it's a global perspective. And I think we at the county and certainly at the city level, we're dealing with these individuals because I suspect maybe some of the golfers have contacted, some of them are Flora or other elected officials at the state or maybe federal level. But I just think that we are kind of the stopgap, the place that that people come to and expect us to act. And I'm not suggesting we overrule Dr. Park. I'm just saying that we look at this, make an evaluation of how we can accommodate, and not just that, like you say, there's two parts. There's the players, the golfers, and the business itself. But that would certainly be helpful. At least we could get back to them and say that we've looked into it.
I'll absolutely look into it. And I will tell you the same thing that I told Assemblymember Flora when I spoke to him on Friday. That because he said that he had discussions at the state capitol, and I told him that if he provided us, if the governor issues executive orders on a daily and sometimes multiple times a day, providing directions to the counties and on a variety of activities, and that if there was an order from the public health officer or the governor that said to open the golf courses, that absolutely we would implement that.
Okay. All right. Thank you.
Supervisor Villapudua.
Yes, sir. I wonder if I can call the sheriff to the podium, please. Sheriff Withrow. Good afternoon, Sheriff.
A little scared to come up now.
Sheriff, just wondering if you have any problems as far as any confirmed cases in the jail, and if so, have you taken any precautions, or what's your plan in the jail?
Yeah, I appreciate the question, Supervisor Villapudua. No, we are very fortunate so far that the measures we have taken have so far kept it out of our jail. We've been very fortunate to work closely with the DA's office and the courts and the public defenders. And the chair also asked about this, and we supplied, hopefully you all got it, a 15-page document that Assistant Sheriff Williamson, who is the one who gets the credit of being one of the few jails around that doesn't have it in. And that's because he addressed it so early with his staff. So we are being very diligent about how we deal with our inmates and the responsibility we have to care for them. And so we're doing everything we possibly can. Throughout that document, you'll see how we're mitigating as soon as they're going to hit our door, people being booked. We're having nurses there, and we've really expanded our medical questions and the testing and that type of stuff. And anyone that shows any type of signs, we're immediately pulling them away from everybody else. The nursing staff, the healthcare staff there takes them, isolates them to make sure we find out whether they have COVID-19 or not, the best that we can without having the test right there. We even tried ourselves to get some of those testing things and ran into the same problems as everybody else. But hopefully sometime we will be able to test right there and know for sure. But because we can't know for sure, we treat everybody like they have it. So as far as the folks that are already in the jail, we're making sure that they stay in their own family communities, if you want to call it that, in their living areas. The DAs and the courts and everybody have worked with us so that it takes a lot more time and it's a lot more labor intensive, but we've obviously limited what we do at the courts. But the ones we do have to transport, we transport them as a group. They're a living group, not the whole jail together like we would normally on a bus. They're a living group so that there's no possible somebody from outside that group contaminates them. We get them to the courts. We get them through their process, and then we get them back. And then we bring on a separate van or bus, a different living group. So we're very cognizant about what we're doing. We've shut down all the visiting, all that type of stuff to make sure that we don't have anything introduced from the outside. Our inmate work crews that used to go out and pick up trash and weeds and everything like that, they are now cleaning crews. And on a multi-times a day, all day long, they are cleaning everywhere. There's any type of contact or areas where inmates might congregate, even in their own housing group. We get in there and we're cleaning those areas. All law enforcement in the county are working together to limit the number of bookings that we're having. So our number of bookings have gone down significantly. That doesn't mean we're not out there being aggressive, but we're citing everybody that we can instead of bringing them into our jail and citing them for court dates 90 to 120 days out. So once we're past that, then we can get the court system back going. So Assistant Sheriff Williamson and his crew have just been incredible in what they're doing, and so far we've been fortunate, but we always plan for the worst case scenario. And if it hits us, then Again, the courts, DA, public defenders have lists ready if we need to clear out a housing unit and we have to release people back out into our community, which we do not want to. Then we have plans in place to do that. But the biggest thing is, right now, we do not want to release people out of the jail early, because these are the ones that we have tried to weed out that don't have to be in the jail right now. We have done that. The DA's office has done that ahead of time, putting them on work programs and things like that, alternatives to sentencing into our jail. So what we have in there should be in there. They're more likely to reoffend, I would think. And so if we let them loose, what's going to happen? They're going to go out and reoffend, and then we're going to have to book them back in, and now they might bring that back into a jail. So let's keep it safe. Let's take care of our inmates, make sure their families know that they're safe. We've eliminated visiting, so we partnered with our telephone company, and we're absorbing part of the cost, and that company is absorbing the rest of the cost. So instead of that face-to-face visit 2 times a week, now they get a phone call, a free phone call 2 times a week. So they stay in contact with their families don't have to worry about them, and that lowers that stress level in the jail too. So that's a very long document that we supplied you, but we've done a tremendous amount of stuff to mitigate that, and their families should feel safe, and our community should feel safe that we're taking great care of them and making sure that doesn't come in.
Would you say that because of the shelter in place and the streets are quiet, as crime went down?
I wouldn't say that. We're limiting the type of proactive enforcement that we're doing. Less car stops that we don't have to do, unless we see a really bad guy or somebody's fleeing from us or something like that. There's somewhat lesser calls for service, I guess. So probably.
Besides looting or anybody taking advantage of these businesses?
So far we've been very fortunate, but we've also, all the police agencies have been very aggressive about that. The retail agencies or the stores that have had to close, and the ones that are remaining open, either retail or businesses have takeout food and things like that, essential businesses, we're being very proactive out around them, having a visual presence there on a regular basis. On the way into work today, I did hear we had a purse snatch, a 211, out at the Lincoln Center area where somebody was probably standing in line to get into a store or just going into a store. So those type of things are still happening. But we're trying to be very, very visible out there and very aggressive towards anyone that would take advantage of this situation and prey on people or businesses that have voluntarily ruin their lives and their businesses that may have been in their families for years to protect everybody else. So we too join with Supervisor Nguyen, and I'm sure all of you, in trying to reach out as much as we can as a community at the Sheriff's Office on a weekly basis to pick a place where we go and we bring in food for everybody so we can support those businesses they're doing takeout. And when we get addressed, somebody calls up and says, hey, somebody's not doing what they're supposed to do, we're responding to these calls. We're not going out and looking for businesses, but if somebody calls and says, hey, this business isn't doing what it's supposed to, we don't think, we're trying to go out and educate and be very proactive and explain the orders to them and give them a chance to correct what they're doing is wrong. We have had 100% success rate with that so far. Everybody that we've contacted and said, I know there was a newspaper article in the Stockton Record. We were there the next day, knocking on the door, saying, hey, these are the rules. We found them to be in compliance, and we haven't had any problems since. The golf courses have been just amazing. As soon as we said, hey, the rules come out, they were just amazing. Absolutely, we understand, and we're going to support our community. And a lot of businesses, it's very difficult for them, but they're being very supportive as they can with everything. So,
let me ask you a question. How about the morale of your employees? How do they feel about coming to work with this virus?
Well, we work very hard on morale at our office, so we've been very upfront with them, and we're being very innovative in what we do. We're going to be speaking with the CAO after this regarding some other innovations we want to do, but these are unprecedented times, so myself and my staff are constantly down amongst our professional staff and our sworn and custody staff, engaging with them, seeing if there's anything else we can do to make their jobs safer.
Are they wearing gloves and protective gear?
They are when they have to. Right now, in the jail is probably the safest place for them. So so far we're so good there. They're being very proactive about any time they go in and out of there, making sure that they're clean when they come back in, and those who can work from home, we're setting them up with laptops or whatever we need to make that happen. We've let them know that, especially in our records divisions and things like that, that anybody who has young children or elderly family members or people they need to care for, we will adjust your schedule where it is. You can type a case during the day, 8 to 5, or you can type a case at 2 in the morning. Whatever you need to do to work out that works for you, then let us know. And if you can do that from home, we'll let you do that from home if you so desire. And we always try and look for a silver lining. And yes, this is a horrible situation that we're going to, but we're going to try and take this negative and turn it into a positive. So now we're reassigning all these people where we've had shut down courts so we get more bodies on the street, or we're putting more people in records because we have a backlog of untyped cases. So now we've got people who normally aren't typing out there doing cases. So we're hoping by the end of this that we'll have all our cases caught up, that we'll have all our coroners' cases caught up because we're severely behind on that. And we're hoping things like background checks and CCWs, those type of things will all be caught up. So at the end of this, we'll be starting fresh when we go back into doing our business as normal. So we're looking at this as an opportunity to catch up on things also.
I have a question for Ms. Nino. If there were like some sort of breakout of the jail, would we be prepared to offer hazardous pay to our employees as far as deputies and correctional officers?
Supervisor Villapudua, item number 3 today that will be presented addresses part of that issue, but that isn't just unique for public safety. We're asking for all essential workers to be addressed as part of the 5% that will be presented today.
Great. Thank you very much.
You're welcome.
And we really appreciate that. It is as difficult as it is for everybody. It is for our first responders and everybody that's essential in our county here to walk out that door and leave your loved one behind and say, hey, I'm going to go out and intentionally engage with people I don't know all throughout the day. And so anything we can do like that to put them at ease and assist them on that'd be great. Thank you.
Wonderful. Thank you.
Thank you, Sheriff. I'm going to echo the thanks, first of all, for the very thorough information that you provided us. It was great to read about how proactive, how early, how really on top of this your staff has been. And I would like to echo what was said here earlier. As much of this as possible that can be made available to the public in as accessible a way as possible, easy to digest, I think will go a long way to making the public feel better if they have a friend or a loved one that is in the jail right now, or they have a friend or a loved one who's working at the jail or in your department. I think having access to that information will go a long way.
Yeah, we appreciate that, and absolutely, yeah, we'll get that. As you know, it's very fluid, so we always want to make sure we give accurate information. So we try and get that out to them more in a verbal form than a written form, because sometimes you can forget to go back and fix those. So on our Facebook and live feeds and those type of things, that we try and get that out as much as we can, and we will continue to do so. And I also, you kind of touched on a point there. I just want to commend Dr. Park on how great she is working with us here in law enforcement, not just me, but all of law enforcement. There's the part of getting information out, and then there's the part that we need to know ahead of time in case some people out there won't react properly to this. Instead of 99% of the people who are going to get behind this, there's going to be that percentage that want to take advantage of this, a cause to start maybe not acting up out there, and we need to be prepared ahead of time. And she does an amazing job of just keeping us informed, considering all those type of things. This crucial information that they have, our healthcare system has, they're very cognizant of what they can get out and how they get it out so that people don't panic and people don't start to freak out. So we really appreciate the hard work that she and her staff and everyone on the medical field side is doing to keep us abreast of what's going on, being cognizant of how that may impact our employees. So it's a nice balance going on in the county, so we're very lucky.
Thank you. And we've got a few other questions here, but I just want to also say your attitude is amazing. Really, I mean, I'm sure it's a big part of why morale is still high in your department because of your attitude, modeling that we're going to turn this into a positive. We're going to get caught up on things. We're going to accommodate our employees and value our employees. I'm quite sure that that's why morale is still high in your department, and it's because of your leadership. So thank you very much.
Thank you very much for that.
Supervisor Elliott?
Thank you. This isn't directed specifically toward the sheriff, although I do appreciate your efforts to be as flexible as possible and take the broader view of the situation and try to enact or try to take actions that are as effective as possible in keeping the entire public safe, and at the same time looking out for the people who work in law enforcement. So thank you for all that you're doing there.
Absolutely.
What I would like to say is just that, and we've spent quite a bit of time talking specifically about golf courses, and things like that, but I'd like to say that I am pleased to see the flexibility that has existed so far in addressing some of the specific questions that have come up in response to certain actions that have been taken. For example, we had previously said that all private RV parks and campgrounds had to be closed. But then we found out that one size doesn't fit all there. There are some people who actually have no other residence than their recreational vehicle, and that is their place of residence in these parks. So we had to make some accommodations for that kind of a situation. And then for landfills, we found that we had to keep some landfills open for personal disposal of garbage as opposed to just the commercial disposals, because some people don't have commercial garbage service, and that's the way they dispose of their garbage, is by taking it personally to the landfill. So it just highlights the fact that one size never does fit all. And so that some of these decisions that have been made, while they may have been the right decision at the time to make to address the specific problem, nonetheless, we have to continually reassess these things to try to take into account other conditions and just ensure that the decisions that we have made continue to be the best ones. So in that regard, I think we need to look at not only just the health issue, but also the physical, emotional, financial well-being issues as well of the people in the county. So, there are a lot of unknowns still out there. We don't know. Maybe this will turn out to be a seasonal issue, much as the regular old flu is. But we don't know. We'll find out soon. But I would just request that we continue to look at all of these policies, just to make sure that the cure isn't worse overall than the problem it was intended to cure. So that's why I say we need to look at all of these aspects to the well-being of the people in the county. So health is certainly, physical health is certainly a good one, but then we ought to look at all aspects of that physical health to allow physical activity and getting out into fresh air, things like that. And we need to look at what happens next, and we need to start planning for transitioning back to some type of normalcy. So we need to look at what measures can be taken that will allow some of these activities to start to be permissible again. Such things as the golf list that was just mentioned. All of these measures that can be taken. So we need to look at what could be allowed if all of those measures were taken. Or can we allow certain types of activities to occur? For example, on golf courses. Well, if we think that people aren't complying with one person per golf cart, then can we allow them to just walk the golf course? That's where they get a lot of the exercise anyway. So let's be looking at some of these ways that we can look at the big picture and strike the best balance that we can to provide for the health and well-being of the citizens of the county. Thank you.
Supervisor Wynn.
Thank you. Sheriff, you had mentioned several times in regards to deputies and their enforcement mode and some of the precautions you're taking, certainly in the jail and on patrol. And you touched upon the family aspect. And so the question is, since law enforcement is one of the critical elements in regards to public safety, and if the sheriff's department goes down, we're in a world of hurt. So, first of all, do you provide? Because I know in certain situations, maybe deputies don't have the child care maybe that they need, especially with the pressure on your department to maintain the order. And so the question is, are there anything in discussion or play in regards to providing either a child care opportunity or maybe even I don't want to say a preschool, but any kind of service that would assist not just the deputies but your entire department in regards to alleviating some of those concerns, which raise a lot of pressure.
We haven't addressed that other than as far as scheduling and being flexible as far as that. But it's funny you touch on that because that has been one of my goals since I've been in office and something I've talked about for years, having raised 3 young children myself while on SWAT and my wife and I on rotating shifts and passing each other with handing babies off in cars and parking lots so one could go to work. And so I'm very, very cognizant of that. And something I've always wanted to have is a daycare type situation out at the department. I don't understand why we don't have it all these years. Well, I probably do. It comes down to money. But it is something because we are a 24-hour business. How neat would it be for somebody working in the jail or somebody working out on the streets to be able to, on their lunch hour, to come in and see their kid at daycare or whatever it is. It clearly would be a secure place. And so it is a goal of mine while I'm there to possibly try and start something like that. We do not have it now. Of course, we'll have to wait and see how we come out on the other side of this financially and down the road. But it is definitely something that we've talked about in our staff meetings before. But the only thing I can do right now is just try and be as compassionate and as flexible as we can. And everybody knows at our department that if something comes up, we step up for each other. And if he needs a day off because of child care, or she needs time off because of that, then somebody else will step up and take that shift for him and make sure, or if they need a week off or whatever. And then a proposal I'm going to be throwing out, kind of a radical proposal because of the incident that we're going on coming up here, should assist with that tremendously. So we're looking at our scheduling on how our officers, what shifts they'll work and how often. And so through this incident, what we have in mind should help with that tremendously also.
The other question is obviously, since your deputies are on the front line and making contacts of who knows who, Is there a procedure in place that if, for example, if one of your deputies posts or tests positive, what's the process? Is there any, for example, are they the first of the line to get tested? What procedures are in place in regards to the rest of the deputies that may, or staff that may have contact with them?
Yeah, we've already had several officers who have possibly been exposed. Somebody was showing signs, they dealt with them. We immediately do an exposure packet for them just in case they were exposed. The people who are showing those signs, if they're taken to the hospital or wherever, if they meet the criteria where they've got the fever and another sign, then they can go through the test and we'll find out the results whether our officer's been exposed to that. If he has, he'll be quarantined for the 14 days to make sure that he doesn't spread it. We've got have that now where our officers ride solo in the cars unless they have a trainee with them. So we're trying to social distance that way with them. Right now, though, the officers who possibly have exposures, if they're not showing any signs, we don't have enough tests here in the county yet to allow them to be tested, to rule it out or to rule it in. So they have to wait to be showing those symptoms before they can get tested. But if they start to show those symptoms, then they have a thing already set up at the county hospital for all the first responders and emergency workers and nurses and everything, that they can come there immediately and be tested if they start to show those signs. So, and then we can get them quarantined. And they're looking right now at the state level, I know, to see if they can get some funding to get them quarantined away from their family, whether we can find a place where they can stay and not bring that home to their family. So we're working on that at the state level also.
Okay. And last question, you probably aren't a prophet, but with this stay-at-home policy going probably another 30 days, maybe 60, there's always a possibility of that internal domestic violence issue that may crop up, and unfortunately those are ones you can't ignore, which means it'll probably require your deputies to handle more calls. And so have you given any thought, or your staff any thought about any expectation of increased domestic violence or crimes or those types of things based upon people losing their jobs, et cetera, which puts a lot of stress on them?
Absolutely, yeah. We've talked about that a lot, not only with our citizens out on the street, but our wives having to put up with us at home, and making sure that our officers all stay mentally healthy also. So yes, we are aware that could happen. It usually pops up around Thanksgiving and Christmas time too, when the families get together and realize this is why we don't get together the rest of the year. So yes, we've talked about that a lot, and you're right. We're sure that's going to go up. We're going to have to respond a lot more to that. That's a very dangerous situation for our officers to respond to, as you know. And so we're very cognizant of it, but it's just going to be the nature of the beast, and we're going to get there. Where again, most of those are shall books if somebody has put their hands on somebody else, and so that could impact us. So hopefully they get out and take a lot of walks.
Good. Thank you.
Thank you. Supervisor Patty has some questions, but I want to just alert staff. I'm still going to ask for our district attorney to maybe come up and give us an update on enforcement issues, because what we're getting a lot of is, well, how come I have to follow this order when other people are clearly abusing it? So I know she's been working with you on that, so I'm going to ask her to speak. And then finally, I'm also going to ask Adam Cheshire, unless there's someone else, to just give us a brief update on what we're doing in terms of the homeless population in regards to the COVID virus.
And you're right, the district attorney has been great on this. She's taken the lead on this to make sure we have the tools that we need to, if we need to take that step. So.
Great, thank you. Supervisor Patty?
Thank you, Madam Chair. A quick question. On your screening process, when calls come in for emergency and 911 and such, are you comfortable, are you able to ask what might be profile questions as it relates to any potential exposure that your deputies might incur?
Absolutely, yeah. We've been doing that for a long time now. As soon as this started hitting, We changed our procedures when a 911 or anybody calls in and we're going to send a deputy there. We have a script for our dispatch, and they're asking all these specific questions, and then we don't air that over the radio because we don't want to violate anybody's right of privacy. Across the MDC, they're either given a message of use universal precautions, is all it says, to give them a heads up, or no COVID-related exposures.
Excellent. Well, I just wanted to compliment you, the leadership, and the rank and file, your undersheriffs, your deputies, and all the staff do an outstanding job in San Joaquin County. I know there's many challenges, and they do show up daily, and they're oftentimes not able to practice social distancing, which much to the dismay of Dr. Park, I'm sure, but necessity mandates that you guys are there on the front line, and we appreciate that.
Thank you.
Thanks. I did have a question through the chair. I'd like to ask County Council a couple of points. As supervisors, just for a point of clarity, Dr. Park does work in autonomy. Her decisions are separate from the board. Is that is correct?
As far as her statutory authority to issue orders regarding public health and safety, yes, those are independent of the board.
So I know people are asking us what we're doing. As Supervisor Wynn had pointed out, he did a mini town hall, and people are, of course, looking for things that we can do and take action on items of concern. And of course, the golf course issue is on the forefront of people's minds through what I've been contacted by. But her decision is separate from and outside of or above what the board could rule.
It is independent of the board. Yes, it is.
And Dr. Park works at the discretion of who?
The appointing authority for the public health officer is healthcare services.
Healthcare services.
Yes.
Okay. Thank you. I appreciate that. And just as Supervisor Elliott had pointed out, I do appreciate, and I'll also share with you, these 49 measures of action that golf course associations are adopting and utilizing for safe play and practices throughout the states, throughout all of the states in the country. They're utilizing these as limiting exposure for golfers, and appreciate that you have a chance to take a look at that, and we can consider, as Supervisor Elliott puts out, we should be fluid. We shouldn't dig in our heels and say, no, this isn't going to happen, when we find something that may be adaptable and acceptable within the parameters of safety and the public well-being. So we'll share this information and look forward to next week's discussion on perhaps the same item if we have any potential movement on it. Thank you.
Thank you. Thank you, Sheriff. Good morning.
Good morning. I think we're in afternoon now.
We're
close.
We're getting close. Thank you for being patient and waiting.
No problem.
I'm just hoping the board can hear a little bit about, I know you've been working with the sheriff and with our cities. A big part of what we hear is, well, how come my golf course has to close when Baskin Robbins is open? And I'm only saying this as an example. I'm just throwing something out there. But a lot of folks are wondering, first of all, is there enforcement? How will it roll out? And what should they do to participate in making sure that the orders are applied equitably?
Great questions. Thank you so very much. The enforcement side of it is with our law enforcement partners, and the community has been very good. We get a number of notifications every day, 7 days a week. Last weekend, the sheriff was out driving around. I was driving around, knocking on businesses, telling them they had to close. So we're working. The community has been wonderful. They're letting us know who is going to be that disruptor or that outlier who's not going to comply. We take our orders from the president to the governor to the county, and then we use those as our directives in guidelining them. And we're working today, and I think this will be a helpful thing, is to better define the non-essential businesses so that it's easy for people to scan through and understand what is essential and what is not essential. So we follow those guidelines and we implement them. And I think the sheriff mentioned this earlier. We've had, at least in the context we've had 100% compliance. Once we go talk to people, we explain the process, why they need to conform. We've had they've made those adjustments. There's always going to be a couple, and with those, we're working, as a matter of fact, we have a team meeting this afternoon on whether or not it'll be a county council initiative, a city attorney initiative, and then backed up with a district attorney initiative. I have a couple tools at my resource. I can charge, and this is probably more law than you'd want to know in a day, but sorry, so I'm going to give it to you anyway. The governor and the president have both said we're looking at an education opportunity and social guilting, if you will. So that was the initial journey, and I think that probably was in part because we thought this was going to be a sprint and it's going to be a marathon. And so we're going to have to adjust a little bit to that. So we're working with everybody to confirm the business is not supporting an essential critical infrastructure. And those definitions are defined, by the governor and the county as well. The obvious ones are bars, clubs, restaurants, unless they offer takeout, which is great. We want to support those restaurants and keep them going. Then we want to we'll order the business to, or we'll educate and inform the business, I should say, the manager, the owner, or whoever's in charge, that this is in violation of the county order. Dr. Part, in this time and in this stage with these health orders, trumps all orders. So when she makes an order, it is the order of the county, and we will enforce the orders that she recommends. So she's done an amazing job. She is working 20 hours a day, and her level of cooperation and engagement with me and my team and the other partners in law enforcement has been really spectacular. And I admire you a great deal, Dr. Park, and I'm grateful for your hard work. And I know you're making tough decisions, but you're making them to save life and not for politics. So I appreciate that. We give the owner or the manager a deadline. We warn them about what's going on. And then if we fail to get compliance, then we have the tools available of Government Code Section 8665 and Health Safety Code 1202.95. And I actually have Penal Code Section 148, which is resisting arrest. And it's disobeying a public law enforcement's lawful order. So if the law enforcement officer is telling the individual that you're not in compliance, we've educated, we informed you, we come back and you're still doing this, then at that point you're in direct violation. So we can take those steps. So far we haven't had to escalate to that point because people have been in compliance. Truly, truly grateful for the community. And I'm grateful for the people informing us about what's going on. And I think because we've taken that approach, people have been, really good about coming in compliance. But if they don't, at that point we can use those tools. And that can be up to $1,000 a day fine for an individual or an organization that fails to come in compliance. So we're looking at those opportunities, and those are kind of the tools that we have right now. It's always very fluid from day to day, and we might be getting more and more tools, and we might be moving away from education into enforcement, but we hope not to. So we've worked with the cities, the county, and then the law enforcement agencies to kind of take those steps. And like I said, again, is education and inform. The second is notice, and the third is enforcement. And enforcement is boarding up the doors. And we have under the orders from the public health, we have the authority. Law enforcement has the authority to board up the business and put a lock on the door. It goes that far. So we don't want to get to that point. Our goal is never to get to that point. And so far, everybody's done a pretty amazing job.
Thank you. And it's my understanding that all of the law enforcement agencies have put out their non-emergency lines where they are, where the public can call to report violations. Is there a single place that people can go to find all of those phone numbers?
I know on my, all of our websites, I think, have it, but I don't want to speak for anybody.
Probably the best place right now is to go to sjready.org, and it is listed in the FAQ.
Perfect. Thank you.
And the other thing that is a tremendous resource, very proud of that, and 211 has just hit a home run, and they're getting bombarded. So I have to say, we all plan, but I don't know that anybody could have ever really planned for a pandemic on this level. But I am working with pretty much every department head in here on a number of different issues, and they have done nothing but been outstanding to work with. I think as board members, I hope you know how proud you should be. We're doing 7 days a week, 24 hours a day, and they're just amazing. So I'm very grateful to be working with such a wonderful team. We can improve, and we know that, so we're always open for the public's comments and how we can improve. Our office is fully operational. 90% of us are working remote. because the court has allowed us to do telephonic hearings. So we have not missed one court appearance, not one filing time, one motion, one anything. We're fully operational. We're just doing justice a little differently than we have before. So I'm very proud and grateful that my entire team is fully operational and delivering justice each and every day. And we're very grateful for the partnership and the leadership of the sheriff. And his team has been, Assistant Sheriff Williamson, and along with the rest have been just amazing to work with under complex situations. So we're continuing to do time not waived prelims. Some jury trials just got a new order this weekend, so they'll be kicked out another maybe 30 to 60 days. And then time not waived prelims are still operating. And we've closed, or the court has closed, not me, that's their jurisdiction. They've closed Manteca and Lodi, and everything is consolidated here in Stockton across the street.
Great. Thank you so much. Thanks for
you.
that update. Now I'm just going to turn real quickly to Adam Cheshire to give us a brief overview of where we stand in terms of the efforts to address the coronavirus with our homeless population. Mr. Cheshire?
Thank you. Good morning. So, initially, what I'd like to talk to you about first and foremost is an effort that is currently underway to develop a place for the homeless to isolate. The key strategy for that is leasing motels locally, trying to find places for them to go where they can exit shelters, get out of that congregate shelter environment, and into somewhere that is clearly going to be safer. I want to highlight the incredible work that many of the folks in this room here today have been involved in a task force. It's being chaired by Assistant Director David Tolliver of General Services, as well as Director of HSA Chris Woods. Their leadership really has been incredible. There's been a lot of progress. There are still a lot of details to work out, but I can say that the sense of urgency could not be higher. We are certainly, in terms of trying to isolate the homeless population, a population with really nowhere else to go, the urgency is being measured in days, not weeks. And so as fast as we can move, this effort is being engaged in, and I'm happy to talk more details about that. Another effort that I am working on in particular at the direction of County Administrator Nino is to try to develop an agreement to secure the San Joaquin County Fairgrounds for emergency use. This is very much a Plan B right now. Again, as I mentioned, the key strategy in terms of finding places for these folks to go very, very quickly is going to be this motel strategy. We are assuming that we will exceed capacity just out of an abundance of caution, and therefore I'm engaged in the strategy. Again, lots of details to work through. Myself, Assistant County Administrator Jerry Becker, as well as some others have been in contact with County Council Miles' office and his staff in terms of developing agreements and sort of the sort of nuts and bolts details in terms of what the county's responsibilities will be, what others' responsibilities will be, and so again, we're working through those. I have been in close contact with folks at the City of Stockton. Obviously, the City of Stockton has the biggest issue with homelessness in our county, and so where I can support their efforts and sort of keep that coordination going, I've been very much trying to stay on top of that. So the state has allocated 30 trailers to the City of Stockton. Those trailers are currently being procured. They are not available yet, but when they are ready, the state will be delivering those directly to the county. We can place those anywhere in the county that we like. They do not have to be in the City of Stockton, but there is a very intentional, coordinated effort happening right now to determine where those trailers might best be placed and how those services would be provided for folks that are living in those trailers. Whom would we place in those trailers? All of these questions are being worked out right now in preparation for these trailers being made available. Certainly the county fairgrounds is being discussed as a possibility. There are other county properties that are being discussed as possibilities, and also city properties that are being discussed in terms of where to place these. I've also been in contact with the city managers of the four large cities, Stockton, Manteca, Tracy, and Lodi, to talk about the trailers. Are there motels hotels in your area that you believe would be viable. And we certainly haven't had any problems with that. We have lots and lots of motels right now that are absolutely empty. And so we have seen huge interest from hotel operators who are otherwise not, realizing any income on these properties to engage in this. And that is great, because without that, we would probably be at a loss. Where the San Joaquin Continuum of Care is concerned, the Board of Directors met on Friday of last week to discuss what they were going to do with their particular section of the total allocation of a source of funds called SB 89, is what we're calling it, or COVID Emergency Response Funds. Approximately $2 million was allocated to 3 separate allocations using the same formula that was used for the Homeless Housing Assistance and Prevention Program. That means that the City of Stockton receives approximately a $1 million allocation of funds through SB 89. San Joaquin County receives about $500,000, and the Continuum of Care receives about $500,000. For the Continuum of Care, they put out guidance on Saturday that they would be allocating those funds 80% for a local emergency response for shelters to deal with the unbudgeted costs that they're all realizing right now in terms of the huge demand for supplies, their inability to acquire those supplies, their need to sort of try to find ways to isolate folks within that congregate shelter environment while we do other things like stand-up motels, and to pay for staff, et cetera. 20% of their allocation they set aside to do something what they're calling reducing density in the shelters. And really what that means is motels, finding places for folks to go so that the number of people in that congregate setting is as reduced as possible. They stopped short of allocating that directly to San Joaquin County, but did mention in their statement to the public that the task force that was formed to engage in that effort is absolutely something that they're focused on in terms of a strong possibility for those funds. There are other things we could talk about, but in the interest of time, I'd be happy to answer yours or anybody's questions.
Thank you. It's my understanding that just late yesterday that for the first time ever, this funding for isolating folks that need to be isolated in hotel motel is 75% is going to be picked up by FEMA, and that's the first time that has ever happened.
That's correct. So we received word late yesterday, and there was a phone call that I was able to participate on regarding what the state is now calling Project Room Key, which is very much this motel strategy. And while a lot of the details remain unknown, it's been a struggle to get straight answers out of the state. I mean, things are moving incredibly fast, and I can't overemphasize how quickly the state really is moving, very much to their credit. But having said that, we don't have a huge number of details regarding what can we reimburse, what can't we. There is, it sounds like we will need to be spending down our emergency funds. HAP in particular is what's cited first in order to access the $50 million set aside from SB 89 for the motel strategy. Regarding our ability to reimburse through FEMA, again, time will tell how that's going to work, but yes, it appears that we can leverage any of the funds that we're using for COVID-19 response with this reimbursement and really stretch those dollars. So looking at that, we think we have enough resources now, assuming that some things fall into place and assuming that perhaps some other jurisdictions start collaborating and cooperating around these strategies. We believe that we can meet this response.
Great. Thank you. Supervisor Villapudua?
Yes, thank you, Madam Chair. So, Mr. Shazar, so you say you got these 30 trailers, and we're looking at hotel rooms, so we got shelter in place. So how would we go about choosing people off the streets like homeless? I mean, most of them don't want to come. So how would you go about finding people that want to come?
Absolutely. So it's interesting that here in the midst of this crisis, we are talking about doing things that we wouldn't normally do, or advocating for really the exact opposite. On any normal day, I'd be telling you that we need to move people from the streets, from unsheltered homelessness into sheltered homelessness for obvious reasons. Right now, that is absolutely the wrong thing to be doing. And so where folks are unsheltered, the guidance that we're receiving from CDC and from the state is leave them in place in order to sort of keep that population stable. We would be pulling people directly from shelters. So these are folks that are presumably not currently active with COVID, although it's very hard to tell sometimes, right? And would be really ideal candidates for isolation.
I get it. Thank you very much.
Yeah.
Thank you. Any other questions? Okay, thank you. I'm sorry, Supervisor Elliott. Pop up here.
Thank you. So you're saying you would be pulling people from shelters, but did you say that they were going to be those who aren't exhibiting any symptoms?
So per FEMA's guidelines, it could be either or. So really local communities can determine which populations they want to serve. Folks that are active, folks that are vulnerable. So for example, people who are over age 65 or people that have comorbidities. So how that's going to work or exactly who we'll be pulling from, obviously we need to be very careful about mixing populations of folks who we know are active with COVID versus folks that are not. So a lot of care is going to need to be taken in terms of who will be placed in these locations, but certainly collaborating and working with the shelters is going to be the strategy in terms of finding the right people to put in these locations.
So is the goal to try to isolate those who are positive?
Yes. The goal is also to isolate folks that are vulnerable but not positive or asymptomatic.
Okay, so
yeah.
To try to isolate them from catching it.
Yeah. I mean, to give you a sense, at this figure that I've mentioned to this body multiple times, approximately 2,500 homeless on the streets of San Joaquin County at any time. Obviously, it's probably unrealistic to find enough capacity for all of them. But considering how vulnerable this population is, considering that they don't have the means to isolate on their own, the more capacity that we can find for those who are healthy or sick will be essential.
Thank you.
Thank you. Supervisor Patty?
Thank you, Madam Chair. A couple quick questions for you. You mentioned the trailers and up to 30 coming to San Joaquin County. Do we have the option or the possibility of allowing perhaps our first responders, as you heard Sheriff Withrow mention, that there's some people that may be in concern of exposure and trying to figure out where they can go. So maybe we can have a trailer available or a series of trailers that they can go there and be safe and, kind of self-isolate and work within those parameters. Kind of curious, I guess, we're getting somebody come up to give an answer as well. Ms. Lima?
Hi, Shelley Lima, Office of Emergency Services. I do want to make a note here that those trailers, the 30 trailers that we're talking about, belong to the city of Stockton. They don't belong to the county. That program was started before this outbreak occurred, and those were coming in anyways. Because of the outbreak, they've kind of tweaked that program and they've added some more funding to it to hurry that along. The city of Stockton is encouraged, however, to work with the county to help them find a location and also to help with wraparound services if we're able. There is a lot of that is going to be needed whenever they do find a location. They've already received 13 of the original group, so we were supposed to get 40, or they were supposed to get 43. So that's the full amount contingent of trailers. And those I'm understanding, I was told to put in a purchase order for them yesterday, and they are almost ready to be delivered. So we really need to work closely with the city to find a location for those trailers.
Yeah, that's the big challenge. The city, I was on one of our conference calls, and the city said they have nobody, no place, they have nothing available. So while they're sitting perhaps in limbo, is there flexibility to allocate 10 or 15 of them for utilization for first responders in this short term?
It's a great question, Supervisor. I don't have the answer. Perhaps Ms. Lima would know whether that was an eligible use of those trailers or not. I mean, in terms of my job, I've been talking about that regarding isolating the homeless, but certainly if first responders can go in there, I mean, I think that would be an excellent strategy. If
desired. I'm just checking and examining the possibilities because our first responders are on the front line daily, and there's some firefighters in Manteca, 3 of them, I guess, that are COVID-19 positive. So, where do they go? What do we do? They've got families and homes.
The trailers are specifically for homeless isolation is a key words in that process. Now, we also mentioned the public assistance grant that the federal government just approved yesterday and gave us that information on that. And these non-congregate sheltering, emergency shelters that we're able to put in, these would certainly work for our first responders in a hotel or someplace. I mean, we don't have to mix everybody in one hotel. We could spread the wealth, so to speak. This is the 75% match capability that we have.
Okay.
And reimburse that through this grant to help our first responders and keep them away from their families if they're been exposed and need some sort of isolation and quarantine. So that is an option as well. And the CDAA funds that we've also been approved could potentially help with the other 25%. A lot of the work that we're doing right now will be able to be reimbursed someday in the future when this all is finished.
Okay, which would segue to my next question. I think, Adam, I may have mentioned it to you, and you said you were looking at the possibilities, so perhaps give an update. That's through CSAC, the the Urban County Coalition was having a discussion, and one of the things that one of these counties had done is they were commingling some of the funding sources and purchasing these motels for a long-term use, not just renting them. They're using the rental money that might be allocated, adding some money and bringing in some other funds that would be acceptable and all fitting within the parameters, and actually owning for a longer-term solution. So any update on something like this?
Yeah, I mean, it's certainly something we've been talking about locally. I'm aware of the Fresno model, and some other communities have been talking about this as well. It is unfortunate, to say the least, frustrating that the planning that we have been engaged in for a year or more around this source of funding called HAP, the largest source of emergency funding for the homeless we've seen in a very long time, all of that planning is kind of going out the window in response to this crisis. And so where we can find a possibility to kind of do both, through, let's say, as the example you gave, purchase a motel using HAP dollars that we can place people in very quickly, right, like today, and then turn around and in the future use that location for permanent supportive housing. I can say those conversations are underway. There is some planning that's ongoing right now. Whether or not, it comes to fruition, it's hard to say, but certainly that is something that we are taking a very close look at in order to try to, respond not just to COVID today, but the homeless crisis that we know is going to be ongoing, and in fact, almost certainly going to be getting worse as a result of what's happening today. So, yeah, absolutely, that's something.
So given the fact that it is possibly getting worse, what would you say can happen within the next couple of weeks? Do you think, I know that oftentimes the government and bureaucracies is paralysis by analysis, and this can be talked about in another meeting, and another meeting is talked about in state and the federal, and it goes on and on and on. What do you think's possible in the next short, couple of weeks?
So for right now, we're limited by the fact that we do not have these funds in hand. An application process to the state was ongoing and continues to be ongoing. That's very much along the timeline that we've been working with for a very long time, way before COVID. We're near the end of that process. I have every reason to believe that the state is going to act probably much quicker than they might have under different circumstances. So the hope is that we see those funds very quickly, and then it'll be incumbent upon us as the local community and the local managers of these funds to implement them quickly.
Is there a timeline where you might think, and I'm not putting you on the line, but in the next couple of weeks, we think we can have something moving?
I wouldn't be comfortable in saying a timeline of 2 weeks or a month, but in terms of what I can say, it's got to happen quickly, because again, we are measuring urgency in days, and so when these funds come online, we have to be prepared, and there's lots of conversations happening about how do we be prepared to implement as soon as possible.
Excellent. Well, thank you. I appreciate it. Just trying to get maybe a timeline and an understanding. Thanks.
Supervisor, if I might also throw in, we also have to be very careful about these different funding streams. There are a lot of very intricate details that go along with whether or not the funds can be used for those particular pieces. For example, the grant the public assistance that was approved yesterday does not include costs to convert a facility. So we cannot convert a facility and use those funds to pay for through this particular grant. Now, some of the other grants we may be able to. So we have to be very careful in how we read these grants and determine where these funds are coming from and how we spend them so as we don't lose available funds that we could have used in the future.
So quick follow-up on that. So what funds, is that a rental fund, or what type of fund are you referring to?
This is the 75% match from FEMA, from the
Okay.
public.
Which allows what?
This is the one that reimburses for anything that we may not have had funds for disasters. So they included the emergency non-congregate sheltering as part of the 75% match approval, which is typically not something that's approved. They want you to congregate everybody into one shelter, but they've approved this piece for this particular event. So there are a few things that are not included in this, and I know that some of the grants that Mr. Cheshire is talking about have little stipulations that go with them too. So it's just a matter of us working really closely together to make sure that we're following all the right streams and plugging in all the numbers in the right place.
Understood completely, and we certainly don't want to do anything that's outside of the parameters. And I would just encourage on that note, you may be able to do something, and working through county council, if that's the best venue, is to do a lease agreement, and that 75% that's recoverable might be a lease agreement, and at the end of it, for 25% of a negotiated price, you have the option to purchase, and you might be able to source something else. But again, it has to all be legal and go through the proper channels. But there might be ways to be constructive and creative with what we can utilize with that funding.
Certainly ways for us to think outside the box.
Supervisor, I will add that all of the feedback I've gotten from the state so far, and again, things change very rapidly, so take it for what it's worth, is that they want us, and we're talking about the Homeless Coordinating Financing Council, which manages the HAP funds for the state. They really want us to continue to use those funds for what we've been planning for. Having said that, they also want us to find ways to use them for COVID-19 response. So what they're telling us is that they're going to be much more flexible than they might have been in the past in consideration of that paradigm. If we can find ways to do this, and it's a sort of a subjective judgment call on behalf of these folks managing these programs, I think those are going to fall in our favor for the kinds of things that you're talking about. So excellent. Absolutely, again, something that we're all keeping in mind.
Right. Thank you.
Great. Thank you. I want to thank everybody again for such a thorough briefing and update, not only for the board, but also for the public. I'm going to real quickly ask the clerk of the board if we received any additional comments that came in during the discussion that have not been answered.
No, I think we have received more comments. We did receive several from employees and members of the public expressing concern about the discussion with golf courses rather than discussing essential employee safety. Several other comments from other departments. Again, same concerns, safety of the employees.
Great. Thank you. Thank you so much. Ms. Nino, is there any final comments you'd like to add?
Nothing more.
Okay, thank you. Then we're going to move on to our second discussion item. And I believe, Mr. Becker, you're going to present this. This is regarding San Joaquin County Essential Services and to approve the temporary closure and adjustment of service hours to the public for certain county departments. Mr. Becker?
Good morning, Madam Chair and members of the board. Jerry Becker, Assistant County Administrator. This morning, I'm here to provide your board a briefing on the county's essential services, changes departments are making to their service delivery methods to keep our employees and the public safe during the COVID-19 pandemic, and to request your board's approval to temporarily close certain county facilities to further safeguard our employees. So this morning, I will start by providing an overview of the scope and scale of the county's essential services. I will then outline the challenges that the pandemic has created for the safe delivery of the essential services and the steps the county's leadership team is taking to safely continue these services. I will then outline how the county's residents can determine what county services are available and how they can obtain these services. And at the end of the presentation, request the board's approval to close 3 county facilities to the public. So first, an overview of the county's essential services. Departments have completed an in-depth review of the many services they provide and identified those services that are critical to the ongoing health and safety of the community. Departments have also identified the staffing requirements necessary to sustain delivery of these essential services. In total, the departments have identified over 260 essential services, 60 of which are currently available online or via telephone service delivery. To deliver these 260 plus essential services, departments have estimated that it will require the work and talent of approximately 4,600 members of the county workforce, the largest single group being our employees at San Joaquin General Hospital. These 260 plus essential services cover the full breadth and scope of the county's responsibilities necessary for the ongoing health and safety of the community. Examples include essential services in the area of agriculture and business, such as produce inspection and code enforcement. For child support, vital services such as the processing of child support payments. In the area of governance, critical functions such as leadership from the board and the county administrator's office, as well as critical administrative functions such as payroll and vendor payments. Health services includes the exceptional care delivered by our county general hospital and the crisis support provided by our mental health department. On the human services side, the county delivers essential services such as CalFresh program and child protective services. There are a broad array of critical infrastructure services provided by our Public Works Department. And for law and justice, this encompasses the vital services delivered by the Sheriff's Office, District Attorney, Public Defender, and Probation. And these are just a small sample of the 260 essential services delivered by the county. So the challenges for service delivery. The COVID-19 outbreak has necessitated significant changes in the daily lives of San Joaquin County residents. It has also impacted the methods the county must utilize to safely deliver its essential services. The county is taking unprecedented steps to limit the potential COVID-19 exposure for both our employees and the public. Exposure to COVID-19 is an inherent risk in the traditional face-to-face delivery method that, prior to the pandemic, was the norm for county service delivery. So to address this, county leadership and the county workforce are together taking steps to ensure social distancing and other actions to reduce the risk of COVID-19 spread. Departments are implementing a variety of solutions that take into account the unique operational requirements of those departments necessary for the delivery of the essential services. For some departments where face-to-face interaction with the public is still required, these departments are taking a variety of safety precautions, including limiting the number of citizens allowed in the lobby at one time in order to ensure appropriate social distancing, and in some cases, meeting with residents on an appointment-only basis. For some departments, their leadership has determined that closing the office to face-to-face interaction is the most prudent and appropriate safeguard. The following is a list of offices that have closed. I want to emphasize that these departments are still delivering their essential services. I want to say that again. These departments are still delivering their essential services. They are delivering them via telephone, email, and other online service methods. And as you heard as great examples from both our sheriff and the DA earlier, Our departmental leadership is being exceptionally creative in developing methods for the delivery of those essential services to keep their employees safe. So, an example, the Agricultural Commissioner has closed the Lodi and Ripon satellite offices, canceled all reservations for the large conference rooms at the facility through the month of April, and the Agricultural Commissioner is considering a transition to an appointment-only model for face-to-face interaction with the public. But the essential services delivered by the Agricultural Commissioner are still being delivered by the department. Other offices or facilities that have already closed include the Assessor Recorder County Clerk, Lovelace Transfer Station and North County Landfill, Treasurer Tax Collector, and the Veteran Services Office. And 3 of these facilities, the board, through the consent calendar, approved their closure retroactively today. So as part of the requested board action today, staff is recommending that the board approve the closure of 3 additional facilities effective tomorrow, April 1st. Those facilities are the County Administration Building, the Environmental Health Office, and the Public Works Community Development Shared Lobby. At the end of this presentation, the board will be asked to consider staff's recommendation to close these 3 facilities to the public. Should the board approve these facility closures, appropriate notification will be made to the public and posted at each of the facilities' points of entry. The safety and well-being of our county employees has been and must continue to be a critical priority. County leadership has already taken unprecedented steps to shift essential service delivery methods to models that protect our employees and the public we serve. This includes a shift to more online and telephone-based delivery models, the opportunity for employees to work from home in cases where the operational constraints allow, and a shifting of employee schedules to reduce the number of employees in the office at any given time to support effective social distancing. Departments are looking to expand these delivery models as well as other options to safeguard the health of our employees. So how do residents determine what services are available from the county? First and foremost, the delivery of essential county services will continue through these challenging times. As discussed earlier, county leadership is significantly limiting face-to-face service delivery and relying heavily on telephone, email, telework, and online service delivery methods. Additional steps will be taken as necessary to protect the county workforce. But through this all, the public can count on the fact that San Joaquin County will continue to deliver its essential services. So to help residents determine what services are available, the county is developing an online listing and status page for essential services. What the board can see on this slide is a prototype of a web page that is under development to provide the public critical information regarding the county's delivery of essential services. When complete, the public will be able to access an information page like this for every county department, which will list the essential services, service delivery methods, contact information, and hours of service. We intend to have the first version of this web page up and available to the public by Friday, April 3rd, so by the end of this week. In the meantime, we want the residents of San Joaquin County to know that all department main phone numbers are staffed and answered during normal county business hours. Email communication is actively monitored and responded to by county employees. Face-to-face services are still available where required, and online services are fully operational. In closing, Madam Chair, staff recommends that the board receive this staff presentation regarding San Joaquin County essential services and approve the temporary closure and adjustment of service hours to the public for county departments. Madam Chair, this concludes my presentation. Ms. Nino, our county administrator, and I are available to answer any questions the board may have on this matter.
Thank you. Any questions? pop up at this point. It seems to have gone down, so just flag me with your hand. Supervisor Wynn?
Thank you, Madam Chair. Yeah, I appreciate the presentation, certainly the overview, and certainly the in-depth review that department heads have done. When you talk about the lack of face-to-face contact, and I guess from my vantage point, we get a lot of emails, about from employees commenting, whatever. But we never hear the real story. We never get the balance of that as to what's really going on. I talked to Chris Wood last Tuesday about his operation. He was sharing me all the things that he's taken to protect the safety of employees. And then I get these emails, and it goes contrary to what he's telling me, and I know he's right. But my point is that I think sometimes when we get these emails that, and I'm sure you get them all, but did maybe somebody put out some information to us explaining the other side? Because without that, we're kind of in the dark. The other thing is you touched upon it, which I think is important, is reducing the number of employees that are in the office or in the building at any given time. I know that private sector, et cetera, other government agencies, they have done a lot of telecommuting online, those types of things. And I think that's where appropriate should be implemented. The other side of it, though, is I know that some businesses, for example, and I think we've talked about a little bit here, and I know the sheriff had touched upon it with some of his operations, is you keep the same individuals together. You don't mix them. There's no cross-pollination, so to speak. And I guess my question is, have we taken steps to, for example, reduce the number of hours or days that our employees are in? And to give you an example, let's say on Monday, Team 1 comes in. On Tuesday, Team 2 comes in, and vice versa, and they rotate. And the next week, the Team 2 works 3 days. The reason I bring that up is because I know that one of the concerns we all have is that if an employee tests positive, what do? How do you quarantine them or the department or everybody they've had contact with, which is in their office space, et cetera? And it would seem to me that at least if we divided, or maybe we can do it in more cohorts, but if we reduce the number of employees that have contact with each other in a particular department, it would seem that if one tested positive or even came down with COVID-19, that we would have a fewer number of employees that would have to be quarantined or set aside, because otherwise we have to close the entire department down because everybody's been there. Everybody has the opportunity to touch the same surfaces, et cetera. And I only bring that up because I know one of the concerns we have, and whether it be with the sheriff's department or any other department, is that if we have employees that test positive, we're going to have to take some drastic action with that department and certainly their continued work. So that would be one thought. The other thing is that when we ask, for example, if the employees are not essential and we send them home, and I know 6201, I understand that, but essentially when they go home, how do they continue to get paid? Is it leave credits, or do we put on administrative leave, or with all the assistance of the federal government? How does an employee maintain their paycheck if they've been asked to go home and they don't have the opportunity to work remotely?
So if an employee is going home right now prior to the implementation of HR 6201 tomorrow, the employees are utilizing leave that they currently have on the books with the county. And that's how we're making sure that they are paid in full. Effective tomorrow, and Ms. Hopkins will be talking about this in greater detail in a few minutes, the employees that meet certain criteria will have 80 hours of paid leave provided to help them address that.
Well, we may be experiencing 60 days of this, which, is going to really, put a lot of employees in desperate straits. I think, and I think we've all touched upon it, at least several of our speakers in regards, we're in certainly a unique situation. However, I think in our creativity and innovation during this time, I think one of the things that maybe we ought to consider is that we talk about this a lot, is that the county is a team. It is 7,000 plus employees. But on the other side of it, we still think in terms of departments. We still think in terms of units. And for example, I don't know what the sheriff's situation is or other department situation is, but my experience in government is oftentimes units become overwhelmed during the normal course of business, not talking about what we're dealing with today, but just the normal course of business. And there's a backlog. There's things that need to be done. They can't be done because of the service levels that are required to be maintained. So my question is it possible to take an employee who's not essential, who doesn't have, to take care of children at home or things like that, would like to work, but their job is not required and so they're sent home. Is there an opportunity to have that employee, since all county employees have had the same training essentially, and I know we all have specialties, but can we take that employee and share them with somebody else who has a need? Because we're going to be cutting down staff, and so obviously there's going to be some shortages somewhere along the way. We talk about shortage of staff. And let me bring that up because, if I were an employee and I'm not essential and I got bills to pay and I'm, going to use my credits, which I may want to use, later this year or even next year, and I exhaust all of them, I would prefer to do something that was meaningful and important, and not have to use my credits and continue to provide a service for the county, albeit not with the public, but somewhere, doing whatever. So I guess that my question is, have we considered those type of options to allow employees to stay on the job, although not in their same department?
Through the chair, Supervisor, it is my understanding, and I'll ask Mr. Miles to correct me if I'm misquoting here, but all of our employees are considered disaster workers. So if there is an operational need elsewhere in the county, certainly it is within the county's authority to move those individuals to where the need is.
And Supervisor Wynn, human resources in our past, whether it was during a disaster or other situations, they have been extremely effective in assisting those departments. Department heads know to go to HR, especially if they have all of a sudden a gap that they need filled. So we've typically used our human resource department to essentially lead that effort.
Well, I know we've done it at OES and disasters in the past, but those are usually short-lived. This may be longer term. Mm-hmm. That's why I bring it up. So an employee would have a longer stay in another department, maybe as long as 60, maybe even 90 days. So that was the reason for my question. We're going to continue to consider that option in regards to employees who truly want to work but don't want to use their leave credits in spite of 6201.
That is our goal.
Thank you.
But I want to make sure that this board understands that we are this past week, especially since HR 6201, and Ms. Hopkins will speak about that, did not go into effect immediately based upon last Tuesday's conversation. People who are out, and because they are that at-risk population, they are currently using their leave credits at this point.
That's fine. Thank
you. Supervisor Villapudua?
Thank you, Chair Miller. I have a few questions regarding the landfill. Would it be okay to call Director Balaji? Thank you. Good afternoon, Director Balaji.
Good morning.
Just wondering, regarding the landfill, how long do you anticipate it being closed? I'm guessing there's going to be a lot of illegal dumping going on. And are your employees, is the Go app still working, and are you guys going to be picking up garbage still?
Okay. First of all, I had to tell you, like this echo, I could only hear you partially. So I apologize if I missed anything. So with respect to the landfills, first of all, just a minor revision or correction. The landfills are operational, right? None of the landfills are closed. The only thing that we have suspended is the self-haul operations at the Lovelace transfer station and at the North County. However, those are the only two that were suspended because you go through, a restricted area, confined area for disposal, those kinds of stuff. However, we're offering that self-haul services at the Foothill landfill. So in a sense, I would say that we have, we are providing every service that the Public Works was providing. We haven't completely shut down anything. We have limited the services at those two locations. The only exception to that is the household hazardous waste handling. So those, we directly come in contact with the people, we sort the things. So that has a very serious exposure both to the customer as well as to the employees. So that's the only thing that has a full closure. Everything else is fully operational at this moment.
Okay, I see.
Yeah. And if I may quickly, Supervisor Nguyen, we are doing what you suggested. Like, we have what we call as a minimal manning, and we have people assigned on shifts, basically, right? We already charted these things out on how we're going to, rotate these people so that to address exactly the kind of thing that you were mentioning here. So we're going to do that. And even on that Public Works and CDD, the closure, we are actually, we already have measures in place to receive any submittals through a lock box that is placed outside the office. So the customer can still come in, submit the stuff, and our staff is available on the phone, right? They can pick it up, at the end of the day, just quarantine that just a little bit, and then we will be processing those things. So as far as the services are concerned, we're on the clock, actually. The services are continuing to be provided. There may be a little bit of a delay or an inconvenience because of the extra precaution we're taking, which is, reasonably expected at this time, both for the customer safety as well as for the employee safety. Other than that, the services are happening as we speak. We haven't suspended other than the HHW, the household hazardous waste. So I hope that clarified with respect to the landfill operations and also the transfer station things as well. And to also add to that, we did that as an innovation, the online bidding stuff, and thanks to that, foresight that the contractors are submitting bids, like, as your board, approved advertisement and such, so that when time comes, we'll be ready to put out jobs because the construction is going to be happening when the summer, comes in. Hopefully this COVID-19 situation flattens out. So we're doing everything we can to make things happen. And we may on the surface look like, we're not doing anything, but we're thinking about things proactively, how to put out jobs so that, the government machine continues to be working actually.
Great. Thank you very much for your input.
Thank you. I have
just a quick question. Mr. Balaji, real quick. I'm sure you have too. I've gotten a lot of calls from especially farmers who say, and it's the self-help haulers or the self-haulers that are dumping illegally primarily. And I can only assume maybe some of the illegal dumping increased because they went to the North County landfill and it was closed, and so they're not going to unload it somewhere else. They're going to dump it somewhere. So my question is, I guess I understand the rationale behind it. I guess how can we ensure that people know before they get to the landfill that it's not open? So they go to the foothill. That's one thing. And the second thing is, it would seem to me, because your department is and your crews are the ones who clean up these illegal dumps. If we could at least keep track and see if there's a substantial increase, because we're defeating our purpose by having to expend additional resources picking it up off the side of the road or in some orchard, as opposed to opening for self-haulers maybe 1 or 2 days a week, whatever it happens to be. But again, it's a matter of communication, and I think a lot of people just were not aware of the closure for them, and therefore they resorted to other illegal tactics.
Very, very good questions and comment, Supervisor Nguyen. And I was very concerned about illegal dumping, thinking that it's going to be just, numbers are going to be off the, roof, basically. Thanks to the civic responsibilities of our constituents, it's not happening. I'm really proud to say that, we anticipated that's going to happen. We had a crew ready to go attack that thing if that thing happens. And I think, like Jim is sadistically disappointed that, we have had one call, right? Like, that is saying that, oh yeah, there is illegal dumping. We could not, one call, that's it. After that, we have still crew doing that patrol. No go request increases with respect to illegal dumping. So hopefully, the people heard what we just said and keep up that good work of doing their responsible thing. The next question you had, how are we letting the people know? We have deployed changeable message signs at all critical locations. We have posted information on the website. We have done press releases, including the frequently asked questions for the people. And we are also placing an ad right now as we speak. Because Supervisor Villalpudua is busy, so we couldn't get a Spanish translator. We're going to be placing an ad in Latino Times, actually, and also other, like Lodi Sentinel type of magazines to let the people know, what is being closed and where they could go. And also, we're using our Facebook page to notify the public as well. And those are some of the things that we have already started doing. So today, you would see that the Latino Times ad would be working probably like in the next issue of it. You will see those things as well. And we're also looking at other ways, utilizing the social media to spread that news as well.
I assume, Mr. Beck, when you talked about that website that starts on Friday, because I know that the one we're using now that has the colored dots or circles, when you go on that at a particular department, it doesn't give you much information about times or whatever. I assume that this, when it's up and running, and I guess we need to tell the public, all the public, that if they want to find out what county service is available, how to get that assistance, that they would give some direction to go to the foothill if they check on Public Works and for landfills or whatever. Because I think that's confusion because people don't know what to do. And when they don't know what to do, they kind of take it upon themselves to take advantage of the situation.
Through the chair, Supervisor Wynn, that is the intent of this new site.
Okay, good. Thank you.
And Supervisor, one more thing I wanted to add also is with respect to that self-haul for the people that doesn't have the garbage services, right? Like, they don't have commercial garbage services because they're rural. Our deputy director is working with the franchise haulers to find any ways to minimize their inconvenience of them having to go the extra 15 minutes to go to that foothill landfill. So hopefully, we could come to, like a roll-off bin type of a deal. It might cost our, the enterprise fund just a little bit more. I'm talking less than $1,000 type of deal. But that would go a long ways in terms of providing good customer service for our constituents during this time. So we're looking into that as well.
Good. Thank you.
Thank you. Mr. Becker, I have just a couple of questions here. One, we've heard both in emails that we've received and also we heard with some public comments today and some folks who've been up here, some sort of basic safety precautions for our employees. One of the things I hear over and over about is there's no signage on any of the elevators. And for many of the buildings that employees are going into, they are filling up elevators. In all honesty, the size of an elevator, it's pretty small. I think if you went in the two diagonal corners, you might be able to say you were maintaining 6 feet. But it also, there's no wipes available or anything when you go in, tissues even, to push the buttons. It seems that there should be some basic protocols that are across the county in every single building. When you use a restroom, here's the procedures you ought to follow. Keep a paper towel on your hands. wash your hands for, sing the alphabet song twice, whatever. But you should keep the towel on your hand while you exit and then toss it out when you get back to your workstation. I mean, I look at what's going on in some of our businesses, and I have to say, I think to myself, how come we're not doing that here at the county for our employees? I mean, how many stores do we go into where they have marked out 6-foot increments? Don't cross this piece of tape when you're in line. Don't get this close, sign on the counter. Stand 2 feet back from the counter so that you can maintain 6 feet from the cashier. I mean, it seems like in our workstation, I've heard over and over from employees, I don't think if I'm in my workstation that I'm 6 feet from the person on the other side. We should put a piece of tape on the desk if that's what it takes, and tell our employees, you need to sit where the piece of tape is so that you're maintaining 6 feet between your coworkers. A lot of the emails and the calls that I'm getting are from employees who are genuinely afraid that we are not practicing the most basic sort of protections for our employees. And I get that not everybody should or needs to wear gloves. Not everybody should or needs to wear a mask. But in the absence of those things, everybody ought to have access to disinfectant wipes, and everybody should have access to tissues or whatever else is necessary to help stop the spread of the virus. And from my standpoint, the 2 places that I hear about the most, and it's no criticism on the department heads or the departments, it's the hospital and it's HSA. And part of it is because they have the most employees. There's a lot of people in those facilities. And what I keep hearing is there's not enough communication. I don't know why I'm deemed essential and have to show up, and my coworkers at home. And it seems to me if we could send more people home, then we could practice better social distancing for those of us that have to be in the offices. But I think the main thing hinges on communication. So what I really want to know is, in terms of implementing these, how do we make sure that all of our employees are, and I realize department heads have to depend on all their supervisors, but it's not happening. They're not, the information is still not filtering down to our rank and file workers. And they're not just afraid for themselves, they're afraid of what they might bring home to their families. And so I want to know, in terms of how we've come up with this list, these 4,600 people, which is a big number. How do we make sure that every one of those 4,600 people gets the information they need to feel confidence in our organization, why they were deemed essential, what's been done to analyze where they can work and how they can work, and what are we going to do as an employer to protect their safety?
So, Madam Chair, first and foremost, I know every department head is listening to this today, and so they just heard the information you provided, and I am confident they will all be going back through their management teams to make sure that we're applying this. With Ms. Nino's approval, we will look to put some generalized guidelines out to the department, recognizing the tremendous diversity in the way and manner and services that are delivered, but knowing that our department heads are exceptional and will take the appropriate steps that are available to them to make the change. I am not surprised, Madam Chair and members of the board, that you're probably hearing a lot from the hospital and HSA, because of the 4,600 employees that I noted, over 3,100 of them are in those 2 departments.
Exactly.
So the majority of our folks are there, and healthcare services being the very next, and of course law enforcement. So there are some real small number of departments that where the majority of our folks are going to be. Again, what I would say is those departments have exceptional leaders, and I know they will be taking to heart everything that's been said here today. But we will follow up with some additional material just to help reinforce that.
And Madam Chair, as a result of what comes out of the next board letter, even without that, we'll make sure we do another. I've done one personally, communication directly to the employees and spoke about employee safety and make sure they're not coming to work when they're showing the respective symptoms relative to the virus, along with them making sure that they feel free to communicate with their immediate supervisor and or their department head. And exactly as Mr. Becker said, our department heads, they have been so cognizant of trying to communicate clearly, but exactly as you said, it doesn't always get all the way down to that person who is, at that front counter. And I get that, and I can understand that. In regards to signage, excellent point. We will make sure through our facilities management, through our general services department, that there's some protocols that are put in place. And even for those departments that are just unique to HSA, that are unique to just the hospital, that there's some standard practices and noticing. Because you are correct. I get her early in the morning. It was before 7:30. Usually there is not another person in the elevator with me. And there was a person today that came up on the first floor. And it was interesting because I was sitting in the far corner, and immediately when she entered, she stood in the other corner. And I'm thinking to myself, there really shouldn't really be anybody else in this elevator with us. And so, right on, we will make sure we do better in regards to posting and reminding, because it's a big reminder, and I think that coincides exactly what Dr. Park was saying. Make sure we remind folks some of those basic principles about washing your hands, making sure you're doing that social distancing. Those common practices will, in the end, our goal is to bend that curve.
Thank you. Supervisor Patty?
Thank you, Madam Chair. Just a couple of quick questions for clarity. We're talking about closing down this administration building, but then some services still being available by appointment. So let's say, for example, somebody wants to get married. They'll be able to still sign up and get services and documentation and whatever they need for a marriage?
I would have to defer to the assessor or recorder county clerk on his intent there. I do not know specifically what his plan is.
If we're closing down the building, you said some service. That's why I wasn't quite clear. You're saying it's as if services will continue based on your presentation, but I'm not getting that all services will continue.
So it is our recommendation that this facility be closed to the public. So if someone is going for a license or something of that nature, it would either have to be via online or telephone, fax, email, delivery, or by appointment. But each department will be evaluating the most effective way that they will be able to deliver those services. So I can't speak to that specific example.
Okay, then just again, for clarity, if you want to close the building, no employees are coming into this building?
No, I'm sorry. Again, closure to the public. So our employees will be here, but we're trying to take steps to further limit their potential exposure by moving for this facility to fundamentally exclusively email, telephone, online services, things of that nature.
Okay, so each department then can continue to engage upon some channel of communication.
Correct.
Phone, even they can call.
Correct.
To speak to that office, and the offices will be staffing down according to whatever they need to continue services.
Again, I would caution through the chair any idea that we might be staffing down. I do believe that it may just again be we have folks teleworking, we have a combination of shifts, so to limit how many people are in the space at any given time. There are a number of factors that the departments will be implementing to safeguard their employees while balancing that with their requirement to deliver those essential services.
Okay, got it. Thank
Supervisor Patty, if I could assist Mr. Becker also in responding. So today, this Board of Supervisors approved the closure because it was retroactive for our assessor, recorder, county clerk. Page 2 of the board letter, hopefully I can answer your question. It says the assessor's office will continue to conduct business and interact with the public via email and telephone. And I'm going to skim through. Second bullet, it says birth, death, and marriage records requests. Requests submitted online through vitalcheck.com or received in the mail will be processed.
Okay.
So I believe that addresses the marriage certificate
I
question.
want to make sure we're not conflicting or, okay, thank you.
Okay.
Go ahead.
Supervisor Villapudua.
Go ahead.
Next.
Go ahead, Supervisor.
I was going to. I think sometimes we get wrapped up in the moment. You know, I know I've talked to some department heads in regards to I call them sneeze shields. You know, plexiglass. I know they're talking about that put in markets between the cashier and the customer. I think probably one of the things we ought to do is consider all our workspaces and consider, because we're just talking about, you know, COVID-19, but there's other things that occur year-round and every year. And it would seem to me that for those employees who have to contact the public, we would provide some type of barrier to prevent people from coughing on them or sneezing on them or whatever, to give them additional protection. And then the second part of it, when we talk about the elevators, you know, we have signs in the stairwells anyway. But, you know, we might encourage employees to use the stairway because you can maintain a distance, even if you're going to the 6th floor. So I think we ought to look at those things in total as opposed to just this particular situation we're in now.
Kind of as the sheriff said, looking for a silver lining, we could all get healthier. We'll all take the stairs, right? Supervisor Villapudua?
Thank you, Chair. I'm just curious, as a county, are we supplying, like to our different departments, are we supplying hand sanitizers and hand wipes, or the department heads, are they in charge of that? How does that work?
So Supervisor Villapudua, it's up to the departments to make those purchases. So let me use the county administrator's office. So we doubled our order as a result of needing them because, of course, when I come in the morning, I'm actually wiping down the conference tables that are being used. And so that is available for each department to make that purchase. But yesterday I did have a discussion with our purchasing agent because it did come up when we immediately took action after our public health order went out, because and also the courts change. Our public defender, right away, she wanted to make sure that her folks were properly protected because they were going to be doing some of their casework in our jail system. And so we knew that there was going to be some back order, but I do know that the respective departments, some have definitely have gotten access to them. In fact, our own department has most recently.
Okay, great. Just curious. Thank you so much.
Hang on one sec. Supervisor Elliott? He's been very patiently waiting.
Thank you. So on the list of facilities to be closed in the board letter, Veteran Services was listed, although we didn't have any separate action to approve that. So I called over to the Veteran Services officer yesterday just to confirm what their status was, and as with most of the other situations that we've heard, they're open for business by phone, fax, email, electronic submission, all of those things, so they can actually do all of the things that they need to do, just not in person. So I believe they are posting some kind of a notice on the door to the facility, and I just want to confirm, are we doing that? I think we should with every other facility that's closing, in addition to posting on whatever other means we have through electronic means, et cetera. I think we should also put a physical notice on the door saying these are the services that will be provided and what manner they will be provided in, whether it's by mail, by email, phone call, whatever.
Supervisor Elliott, I've personally had that conversation with our General Services Director, who is in charge of facilities, and we will get some consistent notification within the front of all of our facilities, and it will be physically posted.
Great. Thank you.
I don't see any other requests here. Supervisor Patty?
Yes, thank you, Madam Chair. And as Perfect timing that Ms. Nino would mention our General Services Director. If we could maybe share, since this conversation is talking about safe spaces and distancing and the concern of the cross-contamination, could we maybe share what practices we're doing as far as our care and maintenance of the facilities for disinfecting doors, workplaces, entries, anything of that nature?
So yes to all the questions you just said. So downstairs, I know coming through the security, there were a number of questions about what's being done there. They are consistently throughout the day, repeatedly wiping out with disinfectant the bins, the areas. There's hand sanitizer there. From a janitorial perspective, they have upped their ante as far as they are wiping down handles, elevator buttons, multiple times throughout the day, not just once throughout, during when they do their normal services. So all of those have been enhanced throughout.
Okay, so, and they have adequate supplies. The reason why I ask is I've seen a couple of janitorial companies showcasing some new technologies that are available for disinfecting exteriors of buildings as well as entryways, walkways, things of that nature where the virus could survive, especially high traffic areas, and also implementing interior protocols to disinfect on a broad spectrum, not just buttons.
Right. It is being done from a broad spectrum.
Excellent.
Wiping things down, yes. And when they were asked about their supplies, they shared with us they had no concern for supplies at that time.
Okay, great. Thank you very much.
Great, thank you. So I am looking for a motion and a second to receive the staff presentation and to approve the temporary closure and adjustment of service hours to the public.
Madam Chair, before we get to motion, do you have additional comments?
Oh, thank you very much. Additional public comments? Thank you.
Yes. So we received a comment from Shelley, who says the patient financial services offices should be considered closed to the public as well. We are located at Benton Hall. They did shy away from encouraging MFA appointments by phone. However, families still come in to drop off papers with their whole families. There has been no change of anything at Benton Hall for the sake of COVID-19. Everyone still works in the same location. No reduction of hours or schedules for the sake of COVID-19 pandemic. We love our jobs, but not the lack of consideration for us. Question referring back to discussion of essential services. In BHS, are all staff considered essential or only crisis services unit? BHS has informed us on Friday that HR would determine who is essential, and if staff were chosen to telework, those staff will not get 8 hours of work pay. Information was vague, and we were not allowed to ask questions in present time. I am concerned that our health benefit will discontinue once because we would not work full-time hours, and this is anonymous. And I have received one more email regarding the golf course asking that they remain closed.
Thank you. I'm going to ask Mr. Culberson to come down real quickly about that first one. That was pretty specific.
Yes, Madam Chair, members of the board, Benton Hall is where we have our patient financial services operations. I will make sure that I will say that the cash collection and the revenue generation is going to be an essential service for our hospital. But let's take a look and see how we can modify duties in that area. Certainly the 6-foot workspace may be difficult, but let me dig on that one this afternoon. I'll report back to your board.
Okay, thank you. I know it's difficult, but if we're going to be expecting our private businesses to maintain this social distancing as an employer, I think we have the same responsibility. We're going to have to figure it out so that we can keep our employees 6 feet apart. I just think it's incumbent on us to figure that out. And if we have to say, put someone, station them at the door and say only one person is allowed to come in at a time to make payments, and would appreciate it if you'd sanitize your hands before you come in, whatever. I just think as an employer, we need to do that for our employees.
And we had a comment earlier today that Rochelle read. I think it's worthwhile. I'm not sure where we are, but a lockbox approach is certainly something we need to take a look at. One of the things, just a comment, because there were some other comments about overall safety at the hospital. We have one of the best infection control practitioners in the area, Martha Bognot, and she's put on our website, the intranet, all of the policies that we have in place, all of the references to the CDC, nearly all facility letters, AFLs that are coming from the California Department of Public Health, but is a lot of information coming at everybody at once. One of the things that CDC just, I think it came up also, referenced earlier today, it sounded like a nursing assistant who might not have been allowed to have a mask. Quite honestly, until I think yesterday, certainly Friday, we did not have much more than about a week's worth of masks for the folks that were going into the rooms. Some of the donations that came through, some of the deliveries have increased our supply, both of the N95s and then of the surgical masks. And so we started evaluating this morning at CDC's recommendation, I think even at the White House, is it possible for all healthcare workers to be issued one mask, which be their mask for the entire day? Something that we looked at last week and said there's no way we can do that because we were under 7 days supply on some of these items, not the N95, but these general surgical masks. And again, that's something my team and I will evaluate. And if it is possible, we'll do that because that's something that is, as some of these masks become more available nationwide, we want to make sure we keep pace providing safe care for our workers, yes.
Great, thank you. I don't want to sound like I'm minimizing how difficult this is for employers to do. I know it's really hard, but I don't think it's fair for us to say, well, we're the largest employer, but we're going to only follow the rules when it's not difficult because we make the rules. I appreciate that it's difficult. I really do. But I do think that if we're going to expect this of all of our other businesses, I think we need to step up. I mean, we're the largest employer. I think it's our job to set that kind of an example. So I appreciate everything you're doing. I do know that the hospital is you're really overburdened right now, and I do appreciate that. So I appreciate you coming up to respond.
Thank you.
Is that it on public comments?
There is actually one more comment. The question is, what is being done for deputies having to do coroner's cases of coronavirus-related cases?
And I believe, correct me if I'm wrong, we heard earlier from the sheriff that his group of law enforcement that are working with OES, that is something that they're looking at, coming up with some sort of solutions. And from what I understood, it may have to occur agency by agency. I don't know that but I understood from the sheriff that they were looking at that and Supervisor Patty brought it up as well, in terms of the ability to quarantine.
Good afternoon, Madam Chair. I'm Dustin Cooling, the captain of patrol. So at the coroner cases, our deputies have PPE that they're wearing. And generally, we know ahead of time if there is some type of a symptom that the decedent had exhibited prior to their death.
Thank you. I clearly misunderstood the question. I thought we were talking about quarantining law enforcement officers.
It was specific to the coroners.
Got it. And so we have that answer.
That are specifically working on people who have died from COVID.
And we are filling out the exposure report.
Great. Okay. Thank you so much. Okay. Then I am now looking for a motion and a second to receive the presentation and approve the temporary closure and adjustment of service hours.
I'll make a motion to approve.
Second.
We have a motion and a second. Please cast your votes. And that is approved 5-0. Thank you. Thank you, everybody.
Thank you.
Next up, we're going to have a presentation from our Human Resources Director, Brandy Hopkins, on implementation of HR 6201.
Good afternoon. Thank you, Chair Miller, members of the board, for your time this afternoon. I'm thinking now it might be best that Human Resources went last. I tried to take notes as we went along, and I'll try to address some of the comments that have come up today. But if I inadvertently miss one, please prompt me so that we can do that. Human Resources is here today to discuss the implementation of HR 6201 and request some authorization to modify some existing county policies to assist county employees. And in doing that, we're going to try to talk about some of the efforts, and you've heard some of the efforts from the CAO's office of things that we've been doing related to the COVID-19 crisis for our workforce. So we're going to focus on a human resources overview of what we've been, steps we've been trying to help our employees, talk about the Family First Coronavirus Act, which has 2 subsections that we started to chat with you last week, the FMLA Public Health Emergency Leave Act and the Emergency Sick Leave Act, which we'll spend quite a bit of time talking about, and then have a discussion about what we should be doing after the implementation. Thank you. I didn't think I wanted to touch it. I'm trying to follow the sign. And I know I'm super short. And we'd like to talk a little bit about part-time employees and some things that we would like to recommend to the board for essential workers. And then we have, when we get to the recommendations, I do have a corrected pay period in date that I need to discuss with the board, and all of our going back and forth to try to get a perfect agenda item. We messed up on a date, and I apologize for that in advance. So to ensure the safety of our employees, we've been talking about how each department has unique business needs and what department heads have been considering. And some of these things you've already heard this morning, things such as telework arrangements for employees whose job duties are conducive to working remotely. This has been done in a variety of ways. Our ISD department has been tremendously helpful to departments about trying to get employees what's called a VPN or remote access to allow them to remote from home. I know they've personally tried to find computers, old ones, new ones, whatever resources we have available to deploy to departments to assist with telework arrangements. And our employees have been really gracious in stepping forward when they've even had their own equipment to volunteer to say, my computer at home meets the needs for the county, and I would be willing to utilize my computer, my cell phone, whatever that might be. So in combination with our departments and our employees, we've seen a tremendous effort to get staff out of the workplace, but still providing essential services to the community through a telework arrangement. We've heard some examples from the Sheriff's Office exactly today, but related to alternative work schedules. I know some employees have come forward and said, well, I'll work at night, I'll work at weekends, and that's helped keep that physical social distancing in the workplace. So many departments have also started to deploy these types of alternative work examples. And Supervisor Wynn, I think you were the one that mentioned earlier, maybe working in teams. I do know of many departments who have done that as well. So maybe they have a Monday, Tuesday, Wednesday team, a Thursday, Friday team to provide for additional physical separation. And those employees, when their team is not in the building physically, may be at home teleworking. So that's spreading both of those types of arrangements throughout the county. CAO Nino approved liberal use of non-sick leave usage very early on. So we did have employees who came forward that said, for whatever that situation is, I would rather be off work. So we found ways to expand those. And then today before you, we will talk about some specific sick leave usage policies that we would like to approve some modifications to assist our workforce. We've talked a lot today about providing non-essential businesses electronically or by appointment. Many departments have already moved in that direction. Some of the other things that we started to touch on is this limiting individuals in the building, asking the public to spread out, setting up appointments. And with that, departments have really implemented regularly disinfected employee workspaces, high-touch traffic surfaces. Ms. Nino mentioned cleaning conference rooms. I can share with you that in many departments, they're doing that in and out. HR has gone around in this building in particular and helped even measure out chairs in conference rooms to make sure that they're 6 feet apart. So there's been a lot of efforts in many departments that are similar to that to help our workforce. And we've talked about, through Mr. Becker, eliminating large work gatherings, that non-essential travel, in-person meetings. And departments have done this at all levels of the organization, from social workers to regular business type opportunities. And we've been using teleconferencing and video conferences as necessary in very creative ways in many places. Mr. Becker did mention we've also been reminding employees of their duties as disaster service workers and that they may be deployed to other places. Human Resources is coordinating that event, and I know of probably a handful of employees that have been deployed to either help at the Emergency Operations Center or potentially be helping in other areas in our organization, depending on their skill set. And then this morning, in one of the public comments, there was a comment about helping employees who are working during this time or helping them with assistance related to their mental health and their physical well-being. HR started yesterday to talk through our employee assistance program and decided is working on trying to finalize a campaign to make sure that we get that information out to employees and they know what resources are available to them and that they're utilizing those resources during this time. We've asked our employees to also engage with us regarding this, and I mentioned earlier some of them have stepped forward and said, I could telework and I have equipment at home, but we've also really emphasized that employees should stay home if they're sick and follow up with their healthcare provider. And that doesn't mean just if they think they have COVID-19. Do you have a cold? Does it feel like the regular flu? Because it's so fluid and unknown, we don't know. So where an individual might typically come to work under certain symptoms, we've asked that they do not and that they follow up with their healthcare provider. We've asked employees to continue to wash their hands with soap and water for at least 20 seconds. We've heard about the happy birthday song, and I hear people singing in the restroom. So I know in many cases employees are doing these things. To cover coughing or sneezing, to follow those social distancing or physical distancing guidelines. It's not about not having social interactions with individuals. It's about employees really taking some self-monitoring to make sure that we're keeping distances. And I've watched employees in the stairwells. We've talked about the elevators. But even just talking to somebody in a room, making sure that they stand at the doorway, the person stands at their desk, for example, and that we're keeping that physical space as we're doing our day-to-day work. And then we do have some employees that are staying at home when they're not performing essential functions. But we've also reminded employees, when I'm off work on Saturday and Sunday, because I have been coming in every day this week, that I don't take that as my opportunity to run to Costco 15 times. I do my part when I'm off work in the evenings, that I'm doing my part when I'm off work on the weekends to stay home, because it is sometimes a challenge. We have errands to run. How can we do those errands? Can we pick them up at Target instead of going into Target? So we've been reminding employees of those things that they should be doing as well. So last week, County Council and I first started to talk to the board about the Family First Coronavirus Response Act, and this is the federal government's response to this public health crisis, and it was passed on March 18th. This applies to all government employers and certain private sector employers, This is effective April 1st, 2020, which is tomorrow, and we're going to talk in a minute about the Emergency Paid Sick Leave Act and that effective date for tomorrow, too. This amends the Family Medical Leave Act, or what's commonly known as FMLA, and this provides for public health emergency leave and emergency paid leave through December 31st of 2020, recognizing that this public health crisis may go on for a period of time. Specific to the public health emergency leave, an employee may be eligible if he or she is unable to work or telework due to a need for child care. As everyone is aware, most schools have closed and have indicated that they may be closed through the remainder of the school year, or if child care is unavailable. The initial 10 days are unpaid, but the employee may use their accruals. So there's vacation leave. We're going to ask the board for permission to use sick leave as well today, and other type of leave banks that an individual may have. The employee may elect to substitute 2 weeks of the unpaid leave provided in the Emergency Paid Sick Leave Act, which we're going to talk about in a minute. So that's 80 hours. An employee may elect to use them both at the same time. In this particular case, what is different between the normal 12 weeks of FMLA that employees receive as job and benefit protection, this actually provides the employer to pay 2/3 of the employee's regular rate of pay if the employee's out under the FMLA public health emergency leave, and this is mainly to care for child care issues. So the employer would be providing 2/3 of the employee's regular rate of pay, and the Act permits an employee to supplement with other accruals that they have available on the books to have 100% of pay. There is a cap at $200 per day or $10,000 total. So that's the FMLA public health emergency leave. The Emergency Paid Sick Leave Act is also effective tomorrow. This is one that last week when I was before you, we indicated was ineffective immediately. We keep talking about how things keep changing, and I think as County Council and I were both up here explaining this act, the Department of Labor was issuing a statement that said, oh, it's not effective immediately, it's effective April 1st. And to be quite honest, I wish they had done a little earlier in the morning because it has created some confusion for our departments, and I'll talk about that in a minute. So this is 80 hours of paid sick leave, which is prorated for part-time, and this runs concurrent with the FMLA Public Health Emergency Leave Act that was mentioned a minute ago. And this must be used prior to requiring an employee to use accruals. So starting tomorrow, if an employee is out for any approved COVID-related reason, we're going to go over those in another slide, they first must use the Emergency Paid Sick Leave Act prior to implementing or using their own accruals. The Act does encourage teleworking, and we've provided some information to this board today that our departments are actively engaging in trying to provide teleworking opportunities to our employees. There are 2 rates of pay, so this one's a little bit more complicated. There's 100% of the employee's regular rate of pay if the employee personally is affected, and the cap is $511 per day or $5,100 in the aggregate. If an employee is off caring for an individual related to the COVID-19 reasons that we're going to go over in a minute, or child school closures, it's $200 per day or a $2,000 aggregate. So there's just 2 rates of pay. We talked a little bit about this last week, but that continues to be part of the Act. So during last week's meeting, as I mentioned, we did come publicly and state that it was effective immediately. We found out after the fact that it was effective April 1st. Based upon the information that we shared during the board meeting last Tuesday, departments made some decisions about what to do with employees, and there were some employees that were encouraged to go home and start utilizing the Emergency Paid Sick Leave Act. We've had to since go back, as Ms. Nino mentioned, and put people on their own accruals once the Department of Labor clarified that the Act is not in effect until April 1st of 2020. I do think that some public comment, and some of you have received some emails directly about why do I have to use my own accruals, and that is the confusion that came from those different implementation dates that we received and our communication of that during last week's board meeting. I can pause for a minute if there's questions about that, or we can keep going. It's the pleasure of the board. Okay, thank you. The qualifying COVID reasons for the Emergency Paid Sick Leave Act include that the employee is subject to a federal, state, or local quarantine or isolation COVID-19 order, as our county is at this point of time. The employee has been advised to self-quarantine due to COVID-19 concerns, so this might be an individual that traveled overseas and was returning to the United States, and his or her physician said, you know, it's probably a good idea for you to stay at home. Or maybe they were potentially exposed in some other way, and their physician is personally advising them to stay home. The employee is experiencing COVID-19 symptoms and is seeking a medical diagnosis. So the actual individual maybe has the cough, has the fever, has some other symptoms that they're seeking medical attention for. Or the employee is caring for an individual who is subject to those same quarantine and isolation standards, and has been advised by a healthcare provider to self-quarantine due to COVID-19 concerns. So this might be, Chair Miller.
I want a clarifying question on that first one that you mentioned. Mm-hmm. If they had been advised by their physician to stay home.
Yes.
I'm assuming that excludes healthcare workers, because we have been telling our healthcare workers they need to go to the COVID-19 clinic and be seen by one of our doctors to make that recommendation. So I want to clarify that so that it's not confusing to our employees.
That's an excellent question. Thank you. Last week, the board did approve an exclusion that is allowed under the Act, and we are working to provide direct communication about what those excluded employees, which employees are excluded. We've been working with County Council, HR has, along with the hospital and the healthcare services. I'm learning my acronyms in San Joaquin County.
Thank you. Mr. Culberson?
Yes, Madam Chair. One of the things we have found in implementing over the last 2 weeks now is that there are some employees that have been reporting to their own provider. And what we said is that's going to be fine. If you don't have a provider, please come to our clinic. It's, again, it's employee health is available. And then if you do go to your own clinic, because of the importance of getting you back and getting on our list, and then also self-reporting, we are asking that you call our employee health department dedicated line and let us know that you are off, and that you have a letter from a note from your provider saying you're to be off for such and such a period of time, and that that you will continue to participate and let us know before you come back. So we did find it was almost impossible to have everybody come to the clinic just to say, hi, I'm not feeling well, I'm going home. What we do think it's important is that we do have a consistent message, and it's Greg Baumgarten, our physician assistant, handling this for us, that we provide you very solid information about what it does take to return. There are a couple of things that are different, of course, if you are positive, if your fever goes away, or if you just had something that may not have been COVID related but wanted to be off.
Okay, well, thank you, because that's different than what we were told here last week. We were told that a note from your personal physician would not be accepted, and you had to be seen by our clinic because we had physicians that had been specifically had the expertise to diagnose in terms of COVID if you are a healthcare worker. So I'm really glad that you've clarified that today, and I hope that clears up a lot of misunderstanding with our healthcare employees. Thank you.
Chair Miller, we'll work to get something specific in writing out as well, so
Thank
that
you.
it is clear to employees.
That would be very helpful. Thank you.
I think we're okay here on talking about the reasons for COVID-19. So these are the consistent reasons that the county Human Resources, under the direction of the CAO, intends to use in looking at some of the other recommendations going forward today when we talk about qualifying COVID-19 reasons, is to stick with what was included in HR 6201. So there is some financial exposure, and this slide should have been titled potential financial exposure. The county does incur county costs related to anything under the Coronavirus Act. So determining the potential exposure, this is an estimate. We're not exactly sure what the actual use will be by employees. But using an average salary, benefit, and tax exposure for the last pay period, an average county employee, it's about $5,000 per pay period. So that's what we used as the baseline. And I'd like to thank Jerry Becker, our assistant CAO, for helping me figure that out. Looking at our non-essential full-time employees that would be eligible for the full 80 hours, we're estimating that to be about 1,800 employees at this time. The part-time employees are still being analyzed, so our estimated cost for the Paid Sick Leave Act in that 2 weeks would be between $9 and $13 million of increased county costs. The actual increased costs related to the public health of the FMLA, the 2/3 that somebody might be out for 12 weeks for childcare, that is an unknown exposure for us at this time. Ms. Nino, did you want to add something?
Madam Chair, board members, this between 9 to 13 million, that is not budgeted. So as departments are incurring those costs for those non-essential workers and those workers that fall under these various options related to COVID, those would be dollars that would take away essentially salary savings, because more than likely it'll occur somewhere in our salary and benefits category. And so when we were here late February, early March with our mid-year discussing a roughly 25 to 30 million year-end budget savings, that'll definitely dip into that. So I just want to make sure the board now, this is completely unbudgeted, a brand new expense that we know we will incur approximately before the end of June of 2020.
And so these numbers are net county cost?
They are not. My understanding, it is gross. It is total cost.
Okay, thank you.
We've had a lot of questions about what to do after somebody exhausts the emergency paid sick leave, and that will include some of the recommendations and board actions that we're asking for today. This public health crisis is expected to be lengthy. First, we heard the end of March, now the end of April, now the end of June. So it's really an unknown quantity for us. But once an employee exhausts the emergency sick leave, we still want to approve qualifying COVID-related time off requests, and that's using that same consistent definition that I mentioned a minute ago. What we would like to do is expand the ability for employees to use sick leave. You heard me mention earlier that the CAO had already authorized pretty liberal uses of non-sick leave, but we would like to seek the board's authority to expand when an individual could use sick leave for any COVID qualifying related reason. They would be able to use their accumulated vacation accruals, any type of administrative leave or flexible floating holidays that an individual has on the books. And once all of that is exhausted, an employee would still be eligible for an unpaid approved time off, which is commonly known as ATO. So those are the available options that we have at the moment. Okay, so related to sick leave accruals, county code and several labor agreements contain provisions that cap an employee's ability to use sick leave at either 64 hours or 80 hours per fiscal year for family use. So really what this means is if I have a child who's been ill and I already took 40 hours off this year, I would only be eligible to use 40 hours of additional sick leave accrual. When we get to the recommendations, we're going to ask the board to consider to eliminate that cap for COVID and allow an employee to use all of their available sick leave accruals for any qualified COVID reason. Under the Healthy Workplace Family Act, part-time employees are capped at 3 days annually, and we would also like to consider allowing part-time employees to use any sick leave accruals that are in their leave banks. So as I mentioned, it's recommended that we remove these caps and allow employees to use all available sick leave accruals for any COVID-19 reason. Part-time employees perform essential services here in our organization, and they really do help the workforce out. We have many part-time employees who are assisting and providing services at the hospital, at healthcare services, and law enforcement and other places. Some labor agreements cap the amount that part-time hours can use in a fiscal year at 1,560. We would like the board to consider lifting that cap until June 30th of 2020, the end of this current fiscal year. I did want to note that last week we mentioned that CalPERS had lifted the retiree restrictions on hours and the ability for a retiree to start without a 6-month break in service without going to the Board of Supervisors. Human Resources is still working with S.J. Sarah on determining 1937 Act's ability to do this. Some of them have been able to implement, and some of the 37 Acts up and down the state are still working on this. HR is assisting S.J. Sarah in determining the process. We're working on creating some reports and some things that they need in order to be able to provide a formal communication of our ability to do this. Right now, our current need may not be as high as we were initially expecting. We have about 100 retirees currently on the books, and most are not near the 960-year calendar cap, so we have some time to determine how to implement this in our organization. Okay. We've talked a lot about essential workers today. Many essential workers continue to come to work or telework to provide those valuable services to our community, and we appreciate their efforts. To support these employees, we are recommending that essential workers receive a 5% supplemental pay for all hours worked between March 30th and May 24th, and the board letter said May 23rd. Potential costs and exposure for this are estimated to be between $3 and $5 million, and that's a gross cost. That's not a net county cost. We would also request recommendation or approval to extend the expiration date of leaf banks with fiscal year expiration dates. So we have several leave banks today, such as administrative leave, floating, and flexible holidays that expire on June 30th of 2020, and we're asking the board to consider extending that to December 31st of 2020 for those essential workers who may not be able to take that time off during this time. So wrapping up all of our recommendations, we are requesting the board to authorize the use of existing leave accruals in compliance with HR 6201 for any qualifying COVID-related reason for any employee who exhausts the Emergency Sick Leave Act through December 31st of 2020. We are also requesting authorization for department heads to allow part-time employees to work more than 1,560 hours in a fiscal year expiring June 30th, 2020, and this is if needed to perform essential services to the community. The last request is an authorization for the county administrative officer to provide essential employees working through this public health crisis the 5% supplemental pay for all hours worked, effective March 23rd through the pay period ending May 24th, 2020, and I mentioned this is corrected from the board letter, and to extend leave accruals with a fiscal year expiration date for usage through December 31st of 2020.
Ms. Hopkins?
Yes.
On that last slide, on the dates, a previous slide said from March 30th going forward, and this one says from March 23rd.
Well, that would be my fault. I apologize for that.
Well, let's go, Andy, if we could go back to that last slide, because I believe, Madam Chair, that's what you're referring to.
Yes, yeah, I apologize.
So see how it says between March 30th and our board letter says effective March 23rd.
23rd. Our initial discussion, Ms. Nino, was to go with the 23rd. Are you still comfortable with that?
I am.
Okay. We'll request March
23rd through the 23rd of March through the 23rd of May.
Yes, please.
Great. Okay. Thank you.
24th of May.
24th of May.
That's 4th. See.
Oh, I apologize for that.
And that is a beginning of a pay period?
That is my understanding, yes.
Okay, so Mr. Becker is shaking his head.
No.
That this is where, Madam Chair and board members, we try to work with our auditor controller to make sure that it's easier to implement than not, because we want a positive thing to remain a positive thing.
Madam Chair, I will confirm this with the team, but it is my belief that March 30th is the beginning of the pay period, which would have been yesterday.
Then I would propose that it would be March 30th, because that's what we had agreed to do, is to make it easier for everyone.
Want to make sure we're clear on what we're...
Yes, it would be March 30th, and it would take it through May 24th.
Okay, great. 30th through the 24th. Supervisor Villapudua?
Thank you. Thank you, Madam Chair. I'm just wondering, all these costs that you mentioned, are they reimbursable under HR 6201?
I would need to confirm with County Council, but my understanding is that HR 6201 is only reimbursing private sector employers and not public sector employers.
That's correct. There have been ongoing efforts in each of the subsequent spending bills that's come from the House and Senate to get that corrected, with the recognition that local agencies pay payroll taxes just like private businesses do. But so far that has not gained any traction.
Okay, thank you.
You're welcome. Thank you. Any other questions? Supervisor Elliott.
Thank you. Regarding this 5% supplemental pay, and taking into consideration the fact that all public employees are disaster service workers, what is the primary reason for proposing that we provide an additional 5% supplemental pay?
We've had numerous discussions about how to recognize the workforce during this time for all of their efforts, and I think the board has heard from some employees about their concerns about coming to work every day, or even those that are teleworking, maybe a social worker, for example, who's still going out in the field, doing a variety of work. And this was one of the ideas that we came up with to support the workforce. Some private sector companies we know are doing this as well. We looked at maybe trying to provide some additional leave time at the end, but given the amount of work that we need our workforce to produce, this appeared to be one of the easiest and simplest ways to recognize them. Ms. Nino?
And Supervisor Elliott, I want to share with you, so probably about the second week in March, I was calling some of our larger departments. I was in contact with our Human Services Agency, our hospital at that point, along with child support. This was probably about the second week in March. And we weren't seeing the major absenteeism. And the reason what triggered for that call was then after that weekend, we had a significant amount of absenteeism among our critical positions in public health. And it happened over a weekend time frame. And so, also, we want to encourage those essential workers to come to work. And I recognize the fact we do get paid a regular salary to show up, and especially if we're an essential worker along with eventually being a disaster worker. That's our role and responsibility when we choose to be employed as a public servant. But exactly as Ms. Hopkins said, we are recognizing that we do have a number of folks on the front line, along with those folks that aren't on the front line, that are providing essential services to the community of San Joaquin. So this is our recommendation on how to recognize those folks and also for them to continue to show up to work.
Okay, so it sounds like that a large part of the reason then is to encourage less absenteeism and to ensure that our essential workers do in fact continue coming to work.
You are correct. That was definitely one of the factors why we started seriously considering this at least a few weeks back.
All right, thank you.
Supervisor Wynn?
In other words, we're providing combat pay, correct, to our employees. Maybe I missed it, but on the one hand, if an employee is working, aside from the 5%, but just working, we pay them a salary and we pay their benefits, correct? If the employee is not working and they're on leave, they either use their credits or we supplement their credits, whatever particular leave process that they're invoking. So on the one hand, if we're paying them a salary and benefits, and on the other hand, we're paying them for their leave credits, essentially, I'm not sure where we're losing money as far as the 9 to 13 million. I'm just educate me, okay?
No problem, Supervisor Wynn. So these 80 hours, Ms. Hopkins, is there a way to put that slide back up that shows the 9 to 13 million? That is not their already earned time. That's a brand new 80 hours of leave related to COVID-19 that I believe one of our board members asked, and it was pretty public that private industry, some parts of private industry, I believe it's smaller businesses, will be eligible for reimbursement, and I know Mr. Miles will respond to that, but public employers are not reimbursed. So that 9 to 13 million, that's why I made sure that is brand new time that our employees, roughly 1,800 of them, will be eligible for above and beyond whatever they have earned in their banks. Okay, so this is a brand new expense.
Okay, so it's just the leave credits that we're paying for, correct? The additional 80 hours.
We're paying for the leave credits under the Emergency Paid Sick Leave Act, and then 2/3 of the employee's salary under the FMLA Public Health, if somebody needs to stay home for up to 12 weeks because of a closed school or childcare.
But if that employee were working, they'd still be getting paid, correct?
If they're working, they would still be getting paid.
I mean, if they were still on the job, and what I mean is we're still having to pay for that employee. The money's, I guess my question, we're not double dipping, are we? They're not getting paid double. They're getting paid for the same amount for leave credits or for salary.
You are correct, but I want to make sure that these are new leave credits that they are eligible for. Because, say for instance, just take an employee that say we do not need 3 account clerks in, and I'm just let me just use the county administrator's office during the time, even though we're currently all say I had a non-essential function, and one of them qualified for this leave. Say that person had a bank, because on average, our employees earn roughly
96 hours of sick annually.
They would still be whatever, and say that person was never sick, but yet they have a child that's at home because they're not in school. They would be eligible for these new credits, and they would not have to dip into their existing earned 96 hours of credits. That's why this is a brand new expense for local government.
But whether you lose or whether you use these 80 hours or you use your existing 96 hours, the only difference is you're not at work, you're home, correct?
No, well, there's two differences.
Okay.
You're not at work and you are at home, but you are essentially using a bank that previously didn't exist. So when you return to work, you will still have those other hours that you earned when you were a full-time employee, not at home, non-COVID related, in addition. So the benefit is this is brand new. This is a brand new cost. These are new hours that they're eligible for related to COVID.
Okay, I understand. I get it when you accrue, for example, vacation.
Correct.
And you accrue vacation and then you retire, you cash it out. I assume the county has that provision. So that's a cost to the county because we've given them, if it were vacation, we gave them an extra 80 hours that we have to pay for. So that's an additional cost. In this situation, even though you give them 80 hours, which is a cushion beyond the 96 that they originally had, it's still a leave credit, which means that instead of coming to work, they're getting paid through the leave credit as opposed to their salary.
You are accurate.
So salary or leave credit, the only difference between the two is the employee is still getting a paycheck, but at the same time, they're not having to come to work. That's usually what a leave credit is for.
You're accurate. They would not be coming to work, and they aren't using their existing leave bank.
Right. I understand.
So there's value.
Okay.
And that's why that's why I'm trying to emphasize that this is a brand new cost to our organization.
Okay. All right. Got it. Thank you.
Supervisor Patty?
Thank you, Madam Chair. Quick question. As it relates to the 5% as proposed today for our workforce that's working, is that a full spectrum of all departments and all the workers that are deemed essential and on the job?
It would be any employee that the department head deemed to be essential, yes.
Any employee that the department had. So we have entire departments. Like, for instance, we have our deputies are out in the field every day. They're on the front line. They would qualify?
They would.
Okay. Okay, so anybody in the county deemed essential. Great. Okay, thank you.
Any other questions? Okay. Thank you. So we are being asked to do three things. First, we're going to see if we've received any other public comments. And then I'm going to ask County Council, do you need three separate actions on this, or can we take these as a group?
Take these as a group.
Okay, fine. Thank you. So I'm going to turn to the clerk, and we'll get some public comment here.
There is one question, and this person asks anonymously, would using this 80 hours affect the incentive pay that county employees get for not using more than half of the sick leave received annually?
So I think they're referring to what San Joaquin County has, the sick leave incentive program. Thank you,
So
Jerry.
again, it just says, would using this 80 hours affect the incentive pay that county employees get for not using more than half of the sick leave received annually?
Can't hear that.
So, Madam Chair and members of the board, if I've understood the question correctly, the answer would be no. This would not affect the incentive leave calculation. The incentive leave calculation is specifically tied to the 96 hours earned, not a new bank such as this 80 hours.
The question was, would using this new bank of 80 hours impact our regular sick leave bank that employees accrue?
Madam Chair, I think what they're asking is whether or not the incentive leave, which is an 8 hours that employees are given each year if they use below a certain amount, it's below half of their sick leave. Okay. So this would not count towards that calculation. Okay, great. Thank you. We may not understand, and I'm sure all of our employees understand that pretty clearly. Okay, so we are able to take this as a group. So we are being asked to authorize the use of all existing sick leave accruals in compliance with HR 6201, authorize department heads to allow part-time employees to work more than 1,560 hours in a fiscal year, and authorize CAO to provide essential employees with a 5% supplemental pay for all hours worked effective March 30th through the pay period ending May 24th, and to extend leave accruals with a fiscal year expiration date to extend that usage to December 31st of this year.
So moved.
I'm sorry, Madam Chair. One quick question just came in. They were asking if this 80 hours can be used intermittently.
My understanding is from the Department of Labor is that it can.
Okay, we have a motion. Second?
Second.
We have a motion and a second. Please cast your votes. And that is approved 5-0.
Thank you, Madam Chair and board members. I very much appreciate your consideration of all of these requests today.
Thank you. Thanks to all the staff. This was an awful lot to present and work through, but we really appreciate all your diligence. Before we go to board comments, I just want to extend a welcome to Mr. Wayne Fox. He's here today. This is our new interim environmental health director. So just want to say hello. Welcome to the team. You're joining us during some extraordinary times. So, but we're happy to have you on board. Mr. Fox, thank you.
Very much.
Okay, any questions or comments from board directors? An awful lot today. Supervisor Wynn?
Just a quick comment. I want to first thank you as the chair for holding this meeting, because I think this is so critical and changes almost on a daily basis. And then certainly thanks to our department heads and staff for the outstanding job they're doing to address the concerns of our residents.
Thank you very much. Anything else? We're going to adjourn then. I'd just like to close with a comment from yesterday from the President of the United States, who said that refraining from public outings is our shared patriotic duty, and we are all in this together. So I think those are good sentiments for all of us to keep in mind, that it's about keeping all of us here in San Joaquin County safe. I appreciate all the efforts from everybody that's working hard to do that, all the extra time. We're going to continue meeting on a weekly basis, and we're going to adjourn now until next Tuesday, April 7th at 9 a.m. Thank you, everybody.